Okay, so I'm just going to do a brief introduction. My name is Dr. James Economopoulos. You can call me Dr. I. I am the Tex-CHIP program coordinator. And Tex-CHIP is a program where we train students to work with special populations and alongside those who work in integrated behavioral healthcare settings. So they get to learn about the roles and responsibilities and functions of other helping professionals. And so we have a great training later. We have first a panel discussion for about an hour. Then we're going to have a training on play therapy. And then we'll do a virtual simulation activity. For those of you who are here, please take advantage of the panel discussion that we're going to have. Prepare some questions for them. We're really excited to have you all. And then I'll go ahead and I'll allow our doctoral graduate assistants to help to introduce themselves, and then we'll have the panelists introduce themselves. Then we'll begin with a case study.
Good morning, guys. I am Kelsey. I am a second-year doctoral student. Welcome, and I hope you enjoy Tex-CHIP today.
I'm gonna bring this to you all, and then y'all can introduce yourselves. Then I'll read the case study.
Good morning, everyone. My name is Dr. Katherine McVay. Are we doing anything else?
Well, I guess they know you. Hi, good morning. I'm Sandy Muñoz. I'm an LPC-Associate. I work at the Children's Advocacy Center. I practice play therapy with kids ages 3 and up through adulthood. Working on my RPT, almost done. Also I do Sandtray. I'm level 3 Sandtray, and I'm EMDR trained as well. So any of the realm of any of those, feel free to ask me questions. I was also a graduate here of TAMU-CC a couple of years ago, and I did the Tex-CHIP program as well.
My name's Fawn. I'm also an alumni, but from way back when, before Tex-CHIP or any of these guys were here. So this is actually my 10th year this month of being an LPC-S. So if you also have questions about that supervisory experience, that's something that I can add. I feel like what we've seen more and more is that a lot of y'all as students think that you're almost at a supervisor's mercy. And you're like, I just need a supervisor so I can get a job. But actually, we work for you. So in addition to my background of inpatient, outpatient, intake in the ER, private practice, I also want to be a resource as far as any supervision questions. You don't have to choose me as a supervisor to be a resource in the community. I am a certified Sandtray therapist, and I'm now a subject matter expert in Sandtray because I magically got enough peer-reviewed journals under my belt. So I know that was super cool. And so today I'll be spending the day with y'all and having a lot of fun by being given free rein by these trusting folks. So I look forward to today.
My name's Deb. I am the lead adult therapist at Bayview with Fawn. I worked everywhere at that hospital and only at that hospital. I did not graduate from Texas A&M. I graduated from a different school. But I'm excited to be here. I'm also working on my registered expressive art therapy. I specialize in adults, but I have worked with kids before. So I can answer any questions about art, what that looks like, using it in different kinds of modalities and stuff. And then I do somatic therapy and acceptance and commitment therapy. I know that's kind of new things, but I got bored with all the old stuff. So I'm breaking out.
Okay. Yeah, Miss Thigpen.
Yes, my name's Susan. First I want to say it's wonderful listening to you guys going into a field that's so needed right now with these young kids. I don't have the experience you guys have, but I am a registered nurse. I've worked with pediatrics for about 35 years. And it's this first time I've ever experienced this situation. So I'm glad to join and see what you guys have to say.
Well, thank you. I'm going to take the mic just to read the case study. Okay. So this is the case study on Lena, and I'm just going to make it a little bit easier for us to see and read this. Lena is an 8-year-old girl in 3rd grade at a public school. Lena is of Hispanic and African American descent, and her family is considered middle class. Lena has a younger brother who is 5 years old and lives with him, as well as both biological parents. Her mother, Julie, reported that Lena was having great difficulty concentrating on her schoolwork. She was easily distracted, unfocused, and would get quite upset while doing homework, which took them 2 hours daily and only could be completed with great difficulty. Lena's teacher reported that she was also very distracted in class, and her efforts to get her to focus were not successful. In addition, Jenna was described as having frequent outbursts in the classroom in which she would yell at other students or throw things such as markers. Maybe that's meant to be Lena. The school counselor was called in to observe Lena's classroom behavior and recommended Lena seek assessment from a psychologist and a counselor. Julie reported that she is uneasy about putting Lena on meds and is concerned that this will be the only solution provided. In addition to behavioral outbursts and trouble focusing, Lena also stated that she often has tummy aches and headaches that interfere with her classwork. In addition, she has reported feelings of fear, worry, and uneasiness, mainly at school. Lena's mom reported that from a recent doctor's appointment, Lena has been diagnosed with lupus, which has other contributing symptoms of fatigue and memory problems, where Lena's mom has noticed that these symptoms appear worse when Lena is struggling with a task or schoolwork. Julie expressed that it was extremely important that Lena be successful in school and life, and she was somewhat concerned as Lena has been testing below grade level, and now with her difficulty focusing, she was falling further behind. Julie admitted that as a result, she tended to put pressure on Lena to do her work correctly and completely, and homework times had gotten extremely stressful and unpleasant. Julie was not sure if Lena maybe could be working harder than she was. She was very frustrated with her daughter's lack of focus and tended to get upset with her and reprimanded her frequently, and even raised her voice sometimes. Julie stated that she is the primary caregiver and disciplinarian as Lena's dad is usually working. Julie stated that Lena is a picky eater and tends to eat mostly processed foods. So now I'm going to go ahead and give y'all back the mic, and then we can begin with our first question.
First question is, what is your clinical impression of Lena, and what would your first steps be in assisting her?
Should I start? All right, I'll go ahead and start. So basically we're seeing that Lena's having a lot of anxiety about at school and presenting with like behavioral symptoms. Depending on how long she's had the diagnosis of lupus, I would look at a couple of things like, yes, generalized anxiety disorder, but we're not going to like rule anything out because we haven't met her yet, and all the information we're getting is only from a parent. We can also look at an adjustment disorder with anxiety, depending on how long she's had the diagnosis. There's going to be other factors like how long she's been at this school, how long she's had this teacher. We're going to look at any changes with like job situations with dad being gone often. And then we're going to look at how mom's anxiety itself is having an impression on Lena. We're going to look at how lupus has been affecting her, how long she's had it, how long she's known about it, how educated they are on the lupus. But then again, we'd have to complete some more assessments, get more questions, do more like in-depth kind of background to kind of get an idea of what other things might be coming up. Some of the first things I would do would be like to have a parent consult. That's what I do initially when I have any child, is like, I'm gonna meet with the parent, I'm gonna build rapport, I'm gonna get to know them, I'm gonna like share about who I am, what the therapy process is, discuss goals for therapy, and then provide psychoeducation for the parent on what to expect. I do child-centered play therapy. So with Lena, it would be more about, I would kind of give an overall, like, here's what therapy is, and here's like when we're gonna meet. And then I would introduce her to the playroom. Here's the playroom. And here, you know, you can explore lots of different things. I'm not going to provide too much information, and I'm kind of just give her some freedom to explore for us to get to build rapport. And yeah, that's it.
I agree with all of that. I would have to say it sounds like Lena's mom might be overwhelmed, and maybe educate her on the developmental age of Lena and what she can expect at this point in her life. Especially with the lupus going on at 8 years old. They're kind of self-identifying at that time, and that might be kind of weighing heavy on her mind as a child, an 8-year-old. But yeah, I agree with what you said. But I think the mom might be overwhelmed, and that might be, she might be portraying some of that anxiety onto Lena also.
Okay. Yeah. I was gonna say the only other thing that stood out to me there was just a little bit with the concentrating, being distracted and focused, and getting upset. So again, not only is that the behaviors that kind of come along with sometimes anxiety, but I would also just want to check in a little bit too on, is there any, again, like motor functioning? So is there a resource for that? Is this somewhere on, like with ADHD? Is that somewhat of a concern that we need to look a little bit further on? Is this something that could be on the autism spectrum too, with some of those behavioral outbursts? And again, too, with those other considerations, looking at the full picture. Again, is this a change? Is this dad not being home? Is this a diagnosis? All of those things could be responsible for some of these behaviors here. It's just, again, this is both teacher reporting this and mom reporting it at home. So those are two places that this is showing up. That's why I would want to look into that a little bit more there too.
I think I agree with what everybody's been saying already. The anxiety part really stuck out for me. ADHD also, because at 8 years old, they should already be starting, if you think of Erickson's stages of development, they should already be kind of trying to figure themselves out, but they're also going to be struggling with that, right? Because they have the inferiority part going on. The family dynamics part always is going to stick out to me because family systems. So I really keyed in on that part because whatever is happening at home is going to translate to what's happening in the other environments that they're going into. So if they have really a lot of stress going on at home, dad's gone, mom seems a little bit over demanding, maybe overwhelmed with everything, plus the health issue in and of itself. It's going to translate into what's going on at school. They can't sit still at home. They're not going to be able to sit still at school if they don't have the right kind of support. So putting those screens in there to see, you know, what other kinds of stuff is going on and what does the home look like? What does school look like? Is she being bullied? Does she have friends? Is she making connections? Because that's all we want, right? We want to be seen, heard, and valued. So if she's not making connections at home, she can't make connections in school because she doesn't know how to do it. So
Yeah.
So the piece, I agree with everybody. This is the fun part about a panel is you're like, yes, and, you know, and again, as you guys have questions, please be asking us. The other piece I would add in, and this is where sometimes you can use countertransference ethically as a little guide. And so as a mom, I would be also thinking, what is bedtime routines like? I have that bias of the day starts the night before. So if she's having trouble in school, let's say Monday morning, you know, what does Sunday night look like? So we hear about process. Is that because mom's stressed and so it's just lots of frozen pizza and chicken nuggets? Or is there some other education and support we can give mom? Maybe it's food instability. We see a lot of that where we work. Maybe they need resources like food banks. And so one of the things during an orientation that we do is we give a list of area resources that includes doctors, but also food banks and such, because we want to be able to put that out there gently without, if they're embarrassed and not able to talk about it, we're just like, oh no, these are area resources. So quick example is when I worked geriatric inpatient, I had a 4-page resource list because it's things like dental care that people don't think about. And so there's those factors. So I would be providing moms during that intake assessment, as you know, Sandy was saying, we have a lot more information we want to gather, is I would also
Mhm.
be passing those area resources and then saying, okay, so where are those spaces where the family is functioning well? So is it something like in the morning, they're able to get up and, sing a transition song while they drive Lena and little brother to school? Where are some of those opportunities that things were already working sufficiently? Because we aren't seeing anything about Lena being hospitalized, for example, whether it's medical or mental health. So can we amplify some of those little sparks so that we're giving mom a boost of, here's also the strengths you already have in dwelling that we are here to also see, hear, value, and build forward on, so that it's not so much the problem model, but it's also getting in some of those strength-based models. So that piece, and then I would really be very curious about what food she is able to digest, what food she can't, because we know more and more research is coming out about gut health affecting mental health and vice versa. But also, what do
Mhm.
they do for just engagement? What are they doing on the weekends? What does play look like, as that's today's theme? Because if it's very rigid, where mom is just, we've got to do homework, and the more she tries to kind of frame Lena in, then it's that spring under pressure. The more you put pressure on it, the bigger the bounce is going to be. And so we're seeing some outbursts at school. We don't know, but we're not necessarily hearing about outbursts at home. So maybe school is the place where the overreaction is happening, and home is the place where there's some underreaction happening, if we think about window of tolerance. And so just kind of that holistic model too, of just walk me through, it's part of our psychosocial question, is walk us through an average day.
One thing I had a thought while you were talking.
Yeah.
I was thinking, and we don't have a list, but one other thing I'd want to know is what medications is she currently on?
Absolutely.
It seems like mom's already cautious and nervous about getting any additional meds. So I'm like, is she on a medication for lupus? If so, has she tried multiple medications? What's their history with medication? And if she is on a medication, I'd be concerned about what are the side effects that we're noticing from a medication? Are these outbursts things happening before or after she's taking a medication? And then we're also going to go back to consulting with, medical doctors or anyone, other providers that she's having to kind of explore. She could have a long history with lupus and trying different things and maybe trying not to be on meds. And so looking at that as well.
And pain levels.
Mm-hmm.
Yeah. So, I mean, there's a lot of that inflammatory markers. I'd be curious about her labs. I mean, there's lots of things to be curious about.
Okay, so we've already kind of touched on questions 1, 2, and 4. So we'll skip to number 3. How would you include other professionals to provide treatment in an integrative approach?
I mean, I would want, if I had the ability, I would want to talk to medical. In my profession where I work right now, I have doctors and nurses available to just go, hey, I have a question. Can you look at this for me? Just to see what they're doing, what they think about those types of things, like, I don't know anything about lupus personally, so give me some information, or where can I find it? Because I mean, we could find anything online, right? But it's different when you actually have somebody who's trained in it and you're not just reading it going, okay, I read that and I have a general knowledge of it. So I would want to talk to medical if I had the opportunity to do it, just to get curious about it, just to see how that works. I would want to talk to the school if I was able to, or have them bring me more information, because school counselors do a lot of work. Like, I give props to those people, not my thing, but they do a ton of work. They do screens, they talk to them. They can provide information that we don't know, like, hey, did you give them Spence's thing? Did you give them a strengths questionnaire? Like, what have you already done? So I don't have to reinvent that wheel. Not to mention the fact that if the child has difficulty sitting still, I don't want to give her a piece of paper that she's already seen, or like ask her the same questions over and over again, because then that gets frustrating. I've already been asked this question before. Why are we not like integrating in there? And then we have all kinds of resources as far as social work, right? We're all LPCs, so like that social work part, we don't normally get too much into that, but we have social work friends that we can go talk to. Hey, what do you think about these things? What have you seen? So anything like that where it's gonna be a different profession in the helping profession at the same time would be super helpful to get just a little bit more information. Doesn't have to be specific to her case, but just like general wise, what would you do if this?
So one thing I want to throw out there, this is almost a little bit of like public service announcement. I think that the more you all stretch your networks personally in the professional world, you're going to find that other fields are trying to integrate with us. So I did not know occupational therapy has a mental health component, and that you can actually get occupational therapy for ADHD, for bipolar disorder, for executive function. And so if you think about it, what it is occupational therapy is your occupation, meaning your interaction with your environment. And that's absolutely what we're hearing about school is the interactions within her environment. So if the school counselors helping with accommodations of like fidget toys or opportunity to get up and take a walk, things like that. But I would also be saying between the lupus and the physical ramifications that and potential long-term medication can have on a body is I would be making friends with my local pediatric OT.
Absolutely. Just to jump on board with that, because the only reason I learned about this is because I had a client who was seeing an OT for some other difficulties with body regulation in general, with like balance and movement, proprioception things. And I was like, I'm very curious, like what is happening in OT. And so I reached out and we had like a fantastic conversation. One of the OTs at Driscoll. And she let me know what she was working on. And a lot of stuff was also related to like emotion regulation and how like, just like being in tune, paying attention to our bodies and learning again, our window of tolerance and what we can and can't kind of manage. And the OT was also working with the teacher who was discussing things like what part of the room should the child be sitting in, the front or the back? What kind of chair are they able to like, sit in to help keep them focused a little bit longer? And that was very insightful for me to learn more about OT. And so that's one that's like really key. The other one I would add on to would be I would recommend a nutritionist.
Yes.
I think that'd be super helpful just for, again, like food stuff related to the lupus for the gut health, and then blood sugar. That might be another thing that might be impacting the child. What are they eating for breakfast? What are they eating for lunch? And just a reminder, when you are working with any other of these integrated professionals, always get a release of information for each provider that you're planning to talk to before you do anything. Even if mom's like, it's okay, like it's fine. If they tell you in session, like, okay, I understand. I still need this piece of paper. Like if you could just sign off on this with like the information, that would be helpful.
Absolutely. And real quick, if she tends to eat mostly processed foods, and if that's a texture or swallow issue, then, I mean, we're asking for speech therapy because she is 8 years old.
Yeah.
So again, if something's kind of been unaddressed, or maybe the meds are making her mouth drier. We know a lot of our kiddos that are on ADHD meds, it dries their mouth out. And so then also things like ADHD stimulants suppress appetite. So kind of looking at just saying,
Side effects.
Yeah.
Those were all of mine. So all of mine.
One more thing also that comes to mind that I did put on the assessments that we didn't talk about was just doing an ACEs assessment to get an idea of any childhood trauma that's occurred prior to them coming in. Because any of the behaviors could be related to trauma triggers, any of the food stuff could be related to trauma triggers, stuff happening at school, there could be something that hasn't been kind of addressed yet, or the child hasn't been open enough yet to discuss. So doing that assessment just to learn more about the child's history with any traumatic events. And then just, whenever a child comes into the room, I'm a blank slate. So yes, I have a lot of information, but that doesn't impact my relationship with the child. I'm just going to see them as a blank slate. They come to me with whatever they feel is important and priority. So if you're like, I have all this information I know about the child, are we going to be working on lupus? Are we going to be working on like, you know, your stuff, your concentration at school. And then she could be like, I have a boyfriend. I'm like, cool. Like, okay, that's where you're at. Like, great. Like,
I think something that we have discovered more of is energy levels, right? And for those of you who've hung out with like the three of us here, we always talk about spoons, right? But there is a lot of study out, and I've been encouraging, especially my patients, is we have more energy when we wake up in the morning, hopefully, right? Like because you've slept and you've recovered, so you have all this energy in the morning. So when we ask what your day is like, I get deeper into that of like, when do you feel most energized? Like not med wise energized. I'm just talking about just in your general day. When do you feel like you're in your flow, in your zone, whatever terminology you want to use? Because if we're meeting this child at the end of the day, we're not seeing what she looks like at the beginning of the day. And at the beginning of the day, she's going to have different energy, right? The mom's going to have different energy because the day just started. So we have more tolerance to handle other things towards the beginning of the day. So I always tell my patients, I was like, you're going to have a difficult conversation, schedule it for the beginning of the day because you have more tolerance to make your way through that. And then you spend the rest of your day using your energy to deal with the other day, right? The rest of the day, as opposed to you use all your energy at the beginning of the day. And now I have to sit down with my employee and be like, hey, you were late for work 5 days in a row, and we have to have this difficult conversation. And she's tapped out because we're out of energy, you know, so it's a lot bigger than it needs to be, right? So some of this too is like trying to modify when we're talking about school counselors modifying their students' stuff, being like, oh, you need fidget toys, you need this, but also can we front load her with harder academic stuff at the beginning where she has more energy and more ability to focus, and then lesser academic stuff at the end of the day where she could just run around and play and do those things that are more holistic as opposed to heavier load of information, right? So I always kind of lean into that of, I want to know what your day looks like, but I want to know how your energy is being used, and have you tried to go to the doctor in the morning and then go to therapy in the morning, go to classes in the morning and change that up and see if that's going to help at all. That's a huge thing.
Yeah, that's a good idea.
Ms. Thigpen, did you have anything?
No, I'm just listening. I think everybody's got some wonderful ideas here and input. It is like a holistic treatment. You're talking about the professionals, you know, you do have to integrate several, not just one, and just make sure her basic needs are met too. I think somebody kind of commented on that as far as rest and food and safety and those types of things in the home.
Okay. But you mentioned the child is having trouble with foods texture wise, or maybe like slowly. Speech therapy, can you explain like how that kind of, you know, helps with the texture aversion to specific foods? Sure. So obviously, as an LPC, it's outside of our scope of practice to render any of those services. So this is just my brief knowledge is if you get a qualified speech therapist who specializes in swallow studies, which Driscoll's definitely going to have some on staff, because again, they have people who are in the hospital needing that level of support. And so there's as itty bitties, there's something called the suck, swallow, breathe pattern. And so if this client had been born premature or had a cleft palate or some of these different medical things, even from the beginning, definitely they'd already have speech hopefully integrated in their care. But if this is something, again, newer and more emerging, and so maybe for sake of argument is we'll say maybe she had healthy eating patterns, could eat the carrots and the cucumbers, you know, at daycare, and now things are kind of decompensating and she just wants something that is requires less masticulation. You know, processed foods oftentimes is pretty soft, and so maybe there's something going on there. Maybe she has tension in her jaw from the pressure she's experiencing. So speech therapy, again, could do swallow tests. And those are involved with, I think, like up to 5 or more, don't hold me accountable for this, please, different levels of viscosity. So they're actually having them put their tongue to the roof of their mouth in certain tests and then trying to swallow, like get all your saliva and swallow that and see can they even produce adequate saliva. So the other piece to that is anything that has to do with your facial structure. So again, if something's atrophied or something's disproportionately tightened and then the other muscles are loose because of that compensation from different muscles, that can really affect her. So in addition to, obviously, we don't know if she has any difficulty with your articulation or fluency. So if she's really struggling to express herself as she's having these outbursts in class, it really is, in a way, I want to encourage that holistic approach of it's valuable to get assessments. And even if the person's like, nope, clean bill of health, then, you know, as Sandy experienced with the OT experience at Driscoll, she's like, okay, great. So I'm not worried about this. I do want to lean more into window of tolerance now. Cool. I can buddy up my theory and still stay child-led. So it can just help. Yeah, good question. Yeah.
I want to add on that because I thought of something else related to the food thing that I forgot to mention. Since she is presenting with a lot of anxiety, one way that kids find control in things is through foods.
Yes.
Processed foods are very predictable.
Yes.
If you think about the difference between fruits and frozen nuggets. So with fruits, it depends on the season of what's available. And then depending on their level of ripeness, they're going to taste different, right? We tasted, you know, you taste strawberries at different seasons, blueberries, raspberries, all the berries, they, you know, sometimes they're more tart, sometimes they're more sweet. So younger kids, they're like, that's not what I expected. That's not the flavor I like. It's confusing. And when anyone in general does tend to have anxiety, then it's like, where do I have control in my life? And if she's like, I can control what I eat, I can control that it's going to taste the same every time. I know what to expect. I know how long it is. I know what my digestive system does with it. Then she's going to be more likely to keep that consistent in her life.
I would just like to add something on there as like food safety stuff. And I know that sounds weird when we say food safety, and psychology is all about what if you think eat right for your blood type, for those types of diets of, you know, if you're type A, you tend to lean more towards this and this is healthier for you. But food psychology wise is tied to depression and anxiety. So if she has a lot of adrenaline, all of the stuff is focused in there, and she has a lot of anxiety, if she's eating foods that have adrenaline, caffeine, things that are going to boost that, she's going to stay hyper aroused and outside of her window of tolerance in her optimal zones, right? So we encourage the opposite of that. So if you are hyper aroused, you want to eat food that's going to bring you down, right, back into your window of tolerance. If you're hypo aroused, we want to eat foods that are going to boost your adrenaline, right? So going for heavier foods, a little bit carbier foods that is going to slow her down to be able to focus. So understanding that like food safety part of when you get up in the morning, what's the first thing you should do? My patients know this. You're supposed to drink 8 ounces of water, flush your system out, and then you have to wait 2 hours before you drink caffeine, because our bodies wake up and it floods with adrenaline because it's like, we have to do this thing in the morning. Let's go. We're not designed to wake up to alarms, right? So our body gets flooded with adrenaline, and then we introduce adrenaline to it by giving us caffeine. And our body goes, well, if you're going to give me caffeine, I'm just going to go to sleep and not produce adrenaline anymore. Then you crash, right? This is that like down that you get during the day. So instead, letting her wake up and see, what is your morning routine? Are you giving her soda, sugar, things like that? And is she eating those spicy foods, these things that are just keep introducing adrenaline into her body, that's going to keep her up, as opposed to regulating her back down, right? It's a little nerdy, but
I like, we love it. Like, yeah.
Any questions? No? Okay. How would you integrate therapy into treatment with Lena? Any specific techniques or interventions?
All right, so I do child-centered play. And so I'd be bringing Lena into a playroom that has the same toys and things that always exist on the same shelf, so that she knows what to expect. I'm going to also make sure that I include things that are kind of presenting issues for Lena. So if medical is stuff that she's often exposed to, I'm going to have a medical kit, which is always in the playroom in general. There's things like shots and, things to check the heart and like play toys like that. There's going to be school related items, there's like notebooks, and she has a space where she can like write things down, or a whiteboard. Also not completely absolutely necessary. Sometimes people think I need to have every single item that this child could possibly use to play it out. Not necessary. The child is going to use whatever's available to them. So if you're like, I don't have a whiteboard in my playroom, that's okay. Like, they improvise. Sometimes they're going to use the toys in ways that you don't expect them to. That's common, that's normal. Maybe they're going to be using the doctor kit because she has lupus. Maybe she won't touch it at all and she's just going to be playing in the kitchen, and that's okay. Cultural considerations. We're gonna make sure that I have a wide variety of different ethnicities, ages of like dolls or Barbies or miniature figures, different kinds of like vehicles, depending on socioeconomic status. We're gonna be thinking about like, what's her background? We already heard, oh, she's Hispanic, she's African American, and they're middle class. So to keep in mind, but it also doesn't necessarily mean she's going to gravitate towards those, but having them available is good for cultural considerations. Again, as a child-centered play therapist, I'm just gonna build rapport, active listening, being engaged, unconditional positive regard, and like setting limits as needed. I feel like in play therapy, it's like, you don't need to do too much. Being present, child-centered, person-centered is plenty, especially if you're starting out as like a new therapist, just being with the child and allowing them to play out whatever they feel like is needed.
And withholding our biases too. Like, so I'm not RPT trained. I did a year of training with Julie Thigpen and then was like, no show rates hurt me. I have bills I need to pay. So I went back to the hospital. So, but one of the things that, we really are aware of, regardless of age and stage, is checking our biases too. So I appreciate that you were saying she might be in the kitchen instead of the medical kit. Because if we go in with our own need for being a helper, which again is a beautiful space to be in as students and as new professionals, is of course you want to be helpful. That altruism does have a little bit of a self-serving component. So just being mindful of whose need is most active in the room. It's what I tell my associates. It's what I tell my students, whose need is most active in the room. My need to provide a medical kit, or my need to just hold space and check my bias, because maybe you got a new puppy and she just wants to enact something about the puppy. And you're like, this has nothing to do with anything. Yeah. And yet it has everything to do with it because it is about her. And so with you, and then all my training was also yeah. And I think that just Rogerian stance is so vital. So the other thing I tell people is your presence is sufficient. When in doubt, remind yourself your presence is sufficient.
I think for me, registered expressive art therapy has aspects of play in it, because we're going to do narrative therapy, we're going to do theater, right? Like, we're going to do sock puppets and, walk around and have fun, right? Because like, again, I specialize in adults and we trying to integrate play back into their lives, as opposed to somebody who, as a child, she should have active play already. And so coming in there going, tell me a story, who's the main character, like those things, and having them do a lot of storytelling. That's what's going to happen in expressive art therapy, right? And then we can act it out, right? We're going to come up with a story this time. When we meet next time, we're going to create our costumes, and we're going to see what she's doing, what she's making, the utilizing of resources, but also, is she able to focus on these things? What does it look like? Did she dress the little girl in like a potato sack and the mom as a queen, right? Because those are all going to tell us all kinds of things. So when you're coming in as a registered expressive art, you're integrating a little bit of that play, but like then getting specific with modalities for theater and storytelling, and then just obviously art, put your hands in the paint. What does that feel like? If they don't like that texture, you know, a lot of times we're like, you can paint, you can touch the paint, you can paint with a paintbrush, and then there's different sizes of paintbrushes. So if they pick this one paintbrush where it gives them distance from the paper, that tells me a lot, as opposed to they want to be in the paint, touching it, right? So that's where it comes from play for us in that aspect of what I'm doing. Looks a little bit different, but sort of the same. She's letting her play with toys. I'm saying, let's tell a story about the toys, right?
Very briefly, I do Adlerian play.
Yes, a very different.
Yeah, so I'm gonna very briefly, I'm gonna like structure the room. So my room is still gonna be set up where things are in the same place every time, but I'm gonna have a little bit more boundaries. So when I come in and introduce the room, there's gonna be a little bit more rules of like, what do I expect in the room? And then I'm also gonna hear from the client too of like, well, what do you want to explore in the room? What's important for you to feel safe in the room? There will be times too where I am a little bit more intentional with activities. Storytelling's a big one of like finding a story, still letting the client lead and maybe pick one out from the shelf, but we're going to read it together and then kind of take time to pause and go back over it. Or maybe I'm reading the story and the child's acting it out with toys in the playroom too. The big like hallmark of Adlerian though is that we always set time at the end to clean up together, and setting those boundaries again of like we work hard and we also like play hard too. So how are we going to cultivate that together in the playroom? So I have a little bit more tools. I'm a little bit more directive, but with that, I still give a lot more choices to the child, client, and adults, because I sometimes use some of those techniques with adults too. But I have a little bit more say in some of the activities that we're doing. They just also have choices in what they're doing in that playroom as well too. So a little bit more, not as child-led, like there's a little bit more structure there too. It's fun. It's fun. Yeah. We have like the animal personalities and things like that too.
Yeah, and as if you start to get more involved in play therapy, you'll start to see that there's a lot of theories within play therapy. And so you're going to see Adlerian here, you're going to see child-centered here, but there's also solution focused. There's also Gestalt in play. Yeah, ecosystemic. There's a lot of varieties in play that you might want to focus on or just explore more about. And anytime you are integrating play with your client, just make sure that you know what your theory is and that you're set within that, and that all of your choices and directions are going to be based in that foundation.
Next question. Does anybody have questions before I go to the next one? No. Okay. What suggestions do you have for novice helping professionals to be mindful of when utilizing play therapy techniques and interventions?
I think I just want to pop off of what you just said there too. It's like, be mindful of like trying those things, right? I think it's really fun and it's exciting, and like be flexible. Well, okay, we got backtrack. One, like be flexible in trying those things, because when working with children, adolescents, and even adults, as you guys are learning and doing that, it like sometimes takes some adaptability or some creativity in getting it there too. But I think sometimes we have the assumption of like, it's like two camps I hear a lot of the times of like, oh, I'm doing play therapy, so it needs to be enacted perfectly, just like it says in the book. Or sometimes people are like, okay, it's here and there is no rules here. And so I would tell you, find that middle ground and just be intentional in using those tools whenever you're using it there too. So prepare, understand why you're doing it. You don't have to have like the full A to Z timeline there, because I think that's also really stressful to put on yourself and your client when you don't know everything that's going to happen in the playroom, but have some intentionality before kind of starting those processes. And again, it doesn't have to be perfect from A to Z, just kind of know like, what is your focus, right? So when you're starting that session or you're starting to use that intervention, like what is the purpose of that? Like what is your goal in using that intervention specifically at that time with your client? And I think starting and working from there is really, really helpful and kind of minimizes some of those like branches that can come from that as well.
I have a couple different things. So like for me, I always teach everybody, and like, cause you know, I supervise students, is you have to be able to pivot, right? So if you think about Carl Rogers just walking with somebody in their space, if they are turning, we're turning with them because we're walking with them. So if you go in and you're like, okay, today we're going to be doing finger painting and stuff, and they're just like not into it, we have to be able to pivot into something that's going to be helpful for them. The other thing too is you have to know yourself and you have to be able to do the technique, because so many times I have students come into my realm in the hospital and they start doing something. They're like, oh, I read this cool thing and I saw this cool technique and I want to try it out. And they can explain it to me. They can read it from a book and they can tell me exactly what they want it to look like. And it goes in there and they have the reaction because they don't know what it's like to be doing the thing. So for me as an art therapist, I do all of the art, everything that I'm going to do with my patients, I do it for myself first and foremost, because I don't want to be in there like hands in the paint and then all of a sudden I'm like ugly crying, right? Because I'm having some kind of issue. So I want to make sure that I know how to do it. I also want to make sure that I know how to modify, because we have a lot of different levels. I do group therapy, so I have a lot of different age groups in my group room, and I have people who can't hold a pencil because they have arthritis, but the technique that we're doing is pencil. So I'm like, okay, well, this is how you do it with a paintbrush, or this is how you do it with this, or they don't like something, they don't want to play with the clay. So then I'm like, here's some gloves to use. So being able to pivot with the patient, being able to modify techniques as you're going through, and then also knowing what it's like to be doing the things. Like if you've never played with Barbies before, and then all of a sudden you have a kid playing with Barbies, that might elicit some kind of response in you. You need to be ready for those things. So don't touch things unless you've actually kind of like, okay, I know what this feels like. I know how to do these things. I know what I feel like when I touch the Barbie, right? These are the things that come to my mind. And then being able to have that healthy balance between the two.
Yeah, I think a lot of what kind of hearing is, and I'll tie this into the last piece of that session, is containment. You know, our job is to co-create with anybody, whether it's a group setting, individual. The family intake is to co-create safe space. And so that requires some measure of containment. And each theory has different words about what that means. So the other thing is allow yourselves to kind of find those like common factors of what the buzzwords are in the theory, either of your choice or the theory of your site. Sometimes sites might say, oh yeah, we're Adlerian, and so this is what you get to do. Other sites might say, oh, you're child-centered, so go brush up on Gary Landreth, you know, kind of stuff. And so for our world in the hospital setting, there was kind of this tenet that came down. We operate under Joint Commission guidelines to be able to bill insurance companies. So we have to do CBT and DBT documentation. Whether we like that or not is irrelevant. It's the site calls for it. And so the other piece I'd say is, as a novice, is don't be afraid to bring in notebooks, something that you can still be really mindful of PHI and make sure that it's shreddable and all of that. But documentation is a form of self-care. That is a way for you to respect the effort and intention that you have put into that moment, and is able to ethically capture what the child or the client brought to you. So I'm sure you guys hear, like, you know, our professors, like, they don't want to document, right?
Yeah.
You know, and I've noticed that with my associates, is as we've gone through our journey and we're practicing documentation through the lens of professional self-care, it's switched their attitude and approach towards what documentation means to them. So sometimes that might mean, you know, if we're in Adlerian stage 1 and there's, you know, a little template. Linda Homeyer has a great book on that guidebook for documentation.
Yep.
You know, so if you're taking in photocopies and you're like, okay, my appointment with Sandy, you know, and you're checking little boxes to keep yourself both accurate, but also kind of framed in, that will help you. And then the other piece of that, paradoxically, is please don't expect yourself to be able to capture everything in the room. Know what to report on and what to omit.
I think for that, what I did, so she was my supervisor, is I created a journal, and I still have this journal. So every time I do an experience with a group, it's whatever it is. So I created a group when I was a student where they come in and they break boards, right? In a psych hospital, we actually got permission to do this. And I wrote down like what I did, right? I used this is their experience. And then every time I do that, I go back and I look at that, and then I write about it again. It's like, what did I have to modify? This is what's going on. This was going on in my body, because was I in the right headspace? And so I have this like now 5-year-long journal of information in there going, I tried this art, it didn't work, I might have to use crayons. And so then if I'm gonna do it again, I'm like, oh, I'm gonna do this group. And then I go back and kind of look at it and be like, you know what? I said crayons, I'm not using crayons this time. I'm using colored pencils because crayons with adults just doesn't normally go over very well. But that is super helpful just to go back and reflect on those things of what you did, what was working and what was not working, and then also what you liked about the experience for yourself, right? Like I enjoyed this because the patients showed growth or whatever it was, right?
I say too, anyone who's new and starting out, trust the process. Just know what you're doing and why you're doing, and then just trust the process. There could be a child who's ready to work, really quickly, might show up session 1 ready to like work through, what they're coming in for. There's some that I've been seeing for a year and you don't know what you're gonna get, and trusting the process is I allow to like I'm meeting them where they are. And if it takes them 6 months, I had a child who took 6 months to speak to me. And I tell this story all the time because every session we saw each other weekly consistently. I think he was about 6, but every time he would show up, I would go to my supervisor and be like, again, nothing happened. And she would be like, trust the process. And I'm like, okay. And slowly over time, I would get tiny shifts in like a change. And it was the tiniest little difference in the session. And then after 6 months, he started working. And then month 8, he was trauma processing. And I was like, whoa, like you're right. Like I didn't know it until I experienced it myself, but trust the process. Just be with the client over and over, figure out what you need in that moment or before or after that session to get you there. Like if your client's showing up and they're fine and they're quiet and they're sitting there, it's like, okay, well, what do I need in this moment to help me feel comfortable, help me to stay engaged with my client? On that note, in this particular case study, what comes up to me is that mom is really anxious. You're going to have parents who are going to be like, this is what needs to happen. These are my goals for therapy. Nothing's happening, month 2, like therapy isn't working. And so remember your why, like remember your theory. This isn't mom's therapy session. I would recommend mom, you need to have your own therapist, and if your child is presenting with something different, if they're working through something different, then that's where we're meeting them. Don't let parents hijack, your sessions or your like therapy goals because of what they want. And they're intimidating sometimes, and they're aggressive and they're anxious and they want things to happen. And so try your best not to let them influence your sessions. And be easy on yourself, we're all going to make mistakes, even as veteran therapists. There's stuff that we're going to come in with. It's not going to go well. I'm like, well, that bombed, well, that happened, and that still happens. So, we're not perfect. We're not going to know exactly what they need, but we're just going to show up for them every single time. And again, just be with them, and that can be more than enough.
Okay, so last question. In your own profession, what personal example can you share regarding utilizing various forms of play therapy in integrated settings with clients who have terminal, serious, or debilitating illnesses?
I started out as an adolescent therapist at Bayview, inpatient, not outpatient. I've only sometimes worked with the outpatient kids, but I struggled at the beginning working with kids all the time, but I just was like, I don't know what to do with these people. I am very much like a teacher where I want to go up and I want to do psychoeducation and those things. And the kids don't really go for that a lot of times, especially at that level of care where they're medicated, they have high stress, they're in crisis and those things. And Fawn, as my supervisor, was like, you like to draw. Why are you not drawing with them? Right. And so that's what I did. I started going in and we crumple up paper and we're playing paper basketball and doing those things. And it was really awesome because I would come into supervision as a student and be like, these kids are bad. They're like running around. I can't get them to focus. I can't do these things. And then when we started doing stuff that was more active, instead of me just sitting up there and be like, tell me about your feelings. And they're like, I'm like, hello, we are required to be in there for 55 minutes, y'all. So, getting them up and moving around and be like, can you shake it out and move around, right? So I do somatic experience, right? So what does it feel like in your body? Those things. And I mostly worked with the girls unit because nobody wanted to work with the girls unit because, you get a bunch of girls in a room. They're all like, 10 to 18 years old. It's not fun. And getting them up and getting them moving around. And I had one particular unit one weekend where it was just like everything was working. We were doing origami, we were making paper airplanes, we got to go outside for a little bit and like throw the airplanes and have races and those things. And then at the end, they were upset that I was leaving. Normally they're like, bye, miss, right? Like they don't like us. So it was really powerful for me to be like, I did something over Friday, Saturday, and Sunday when I was working with them that helped them learn more about themselves in the world that they're living in. And that was really powerful for me. And so I stayed on adolescents for a while until I got the opportunity to move back to outpatient. And I was like, okay, bye. That was like my big experience was a good weekend where I was just like, I saw growth that was in an inpatient setting where typically we're just in there as the safe person going, everybody safe in here? Okay, bye. Right.
I have a very interesting perspective on the integrated care setting that I work in. So I work at the Children's Advocacy Center, and we provide services for children who have experienced, who have positive outcries of abuse. And so the other integrated professionals that I work with are law enforcement and CPS. So I'm working with like detectives and police department and CPS, and it's helpful for the cases. They have a completely different training experience, right? And the positive thing about working with them is that I learned a lot of information about how they do the investigations, how they do the questioning, like who in the family they're talking to, like their interview process, about like how they kind of work with kids. Oh, we also work with the Driscoll care team, who does the SANE exams after outcries of abuse. So it is helpful working with these different teams because we find out a lot of information about the child, about the family before they come in. The challenging part about that, and there are a couple of different challenges that come with it, is that sometimes I find out more information than I'm ready to know. Sometimes I find out some really horrific details about the abuse that the child would not have told me. And that impacts my relationship with the child. So most of the time I get one line knowing like their history when they come in, and that's more than enough because I'm like, I don't want to have, again, a bias or more of a bias than I already do have with them coming in, because sometimes, children come in with sexual abuse and sometimes they're fine and it doesn't impact them that much, and they have a good support system and they're in therapy for a month and they're fine. Some other kids have a complex trauma history and it's going to take them years to work through what's happened with them. So in that sense, I'm like, I don't want to know that much information, but it's kind of hard because it's part of the integrated roles. The other part is they think that I'm an investigator or I'm a detective in the therapy room. And so there's been multiple times where I have to reiterate my role as a therapist is to process the aftermath of what happened. I'm like, because they're like, oh, trials coming up. Like, that's a big thing. Trials coming up, like, they need an outcry. Can you like have them talk about their perpetrator? And I'm like, no, like I'm a child-centered play therapist. You understand, I don't ask questions in the playroom. That is part of the theory. That's part of my role as a therapist. And they'll be like, but we need this to put the perpetrator in jail. Like we need them to say these things. And I'm like, I get it, but this is also where I give the child free will and autonomy to decide what they want to say and to who they want to say it to. And that is hard and challenging. So I would say know your role and like advocate for your client. If your client is the child, then you're speaking on behalf of their best interest. And don't let others like bully you into being like, oh, well, you could just do it this one time, or, I'm like, no, like that's not, that would, impact my relationship with the child negatively if they knew that that was my intention in therapy and that's what I was going to use it for. So I try and be very like honest and upfront about the expectations of therapy and about what confidentiality looks like.
Mm.
The other part of it is that I also use it as like a way to like advocate and educate the other providers. So if they don't understand what my role is, like, oh, well, how can I show you? And the CAC, since we do partner with these other agencies, we do have different times where we're going to have presentations on this is what the therapy department looks like. This is who you can refer to us. This is what we do in therapy. This is what therapy looks like. Here's the expectations for before and after therapy. So they have a better idea of what to expect. Another time, something cool that we got to do within our own agency is that we did do, we had them do a Sandtray training, where we kind of led them through just like directive Sandtrays with their own vicarious trauma. And people recognize how difficult it is to look at your own personal life, your own personal history, because sometimes they'll be like, oh, Sandtray, that's not working. Like they're just playing. You're gonna hear that all the time. They're just playing, they're not doing therapy. And I'm like, let me explain to you how this process works, what it looks like. And then once they get to try it out, they're like feeling emotional, having things come up. I'm like, this is what your child, this is what the children are going through who come through the center. This is what they're experiencing. And then they have a better idea of like, oh, okay, I kind of have a better perspective on it. And so, yeah, be an advocate for therapy, be an advocate for play therapy, and yeah, show others like what it is and what it's about.
I'll piggyback on what Sandy's saying. The specific situation I can offer is I did contract therapy with the State Supported Living Center for 4 years. And so parallel of the behavioral health staff would say, well, they did this on this date. Will you talk to them and tell them they can't do that anymore? And I'm like, wait, what? Like, no. So there are times where other people will give you information and you're like, I can't bring that in the space. Like that is not appropriate at all. Yeah. And so you kind of compartmentalize. And so I did do Sandtray therapy, a very curated kit with my clients there because they had a high swallow rate of things, batteries, pieces of glass, bottle tops, and screws, anything they'd find. We have a high rate of swallowing foreign objects there. So there was one client that I had two types of sand. I had the kinetic and I had the regular. And just your smaller, not regulation size, but just your smaller, kind of like I think probably the kits you guys had here. Yeah. And he was supposed, his staff wanted him, and they'll even say like, when you see your therapist, you need to talk about this.
Yeah.
I'm like, and then, I'd have like poor attendance for 3 weeks. And I'm like, where's so-and-so? And they're like, well, they don't want to come see you. I'm like, well, what's going on? And then I'd see them and they'd say, well, I didn't want to tell you, blah, blah, blah. And I'm like, you don't have to. Okay.
Yeah.
So a client who has hit his head against walls so much that he actually has a permanent dent in his head. And it's visible. And so when he would do headbutting for various reasons, again, staff would get worried and say, you need to talk to him about it. I'm not addressing it unless he brings it up. And he might say, that's the thing, like paradoxically, when you don't ask, they volunteer. Like, did you see this? Did you, kind of thing. I'm like, oh, tell me, and
Yeah.
what would you like me to know about this?
Right.
These very gentle. So he created a sand tray with kinetic sand. Him and his roommate were having some questionable behaviors, and he did allow me to take pictures of it. but he ended up putting some of the moss on top of the two figures. And he said, well, those are moldy, because he knows mold is bad, right? He's like, well, those are moldy behaviors. We're just acting moldy to each other. And I was like, oh, okay. So how do we clean up the mold? And so he then was able to verbalize the skills of, well, I just needed to walk away. I could ride my bike. Riding bikes around campus is huge over there, you know? And so then he created a second scene in the sand, kept those guys under the mold, but put two more, just your little plastic figures, upright with no mold, but put some trees and some flowers. And so there's some really simple ways that you can support people while also healthy compartmentalizing, saying, I'm keeping other people's agenda outside of the room so that it stays the client's agenda.
I mean, I think that those are all really good examples, and I don't have experience in integrative health.
Thigpen, do you have any experience with parents in pediatric?
No, I mean, I know the importance of play therapy in the hospital setting. I don't have any terminal, I mean, we're acute care, but I do know the importance of it. You know, we have a playroom to get them out of their room, and we're always bringing stuff we buy for the kids, coloring books and paints and puzzles and different things like that. Just even in the acute care setting, they need to have that play therapy, just to give them something to do.
Any of you guys have any questions for our panelists? Okay.
Earlier you had mentioned that you was wanting to talk to you for like 6 months. What did y'all do? You just said.
You stop session, yeah.
Yeah, so basically he would come into the room and the first couple of months he would just stand. He wouldn't even sit down. And first couple of sessions I was like, you know, mostly I'm reflecting feeling, you know, as a child centered play therapist, I'm reflecting feeling. So he would be engaged with me in that he was making eye contact with me, but he would also wear a hat, so it was kind of hard to see. And I would go in and like sit on the floor, sit in a chair in a you know, like a non-dominant, like non-power, like dynamic, like position so that he didn't feel threatened. I would reflect feelings, so I would say like, oh, today you would just like to stand there. And then I would say, oh, you're looking at all the toys in the room. Sometimes it's hard to decide.
Tracking. So
Yeah.
tracking, reflecting, validating, you know,
Mhm.
your core skills.
Yeah, so just basic skills, and I would do that, and I, you know, it's a long session when nobody's talking. So sometimes over time, I would work with my own like discomfort of, and I would just do some deep breathing, and I think maybe I can't remember if it was month 3 or 4 where I started getting really bored. And this was in the afternoon. I was like, oh no, like I would start feeling like uncomfortable, like, oh, I have to sit in the quiet session today. Like, so I'd be really bored, and I would still reflect feeling. And then sometimes I would set some things out. I would set pieces of paper out, and I was like, I'm going to do some coloring, and you can decide to do whatever you like to do. And just for my own like sanity. But over time he started playing with a Nerf gun, and he would play with one toy. I think this was maybe month 4 or 5. He would play with one toy and he would just shoot the Nerf gun at different places. And so then that got exciting for me. I was like, oh my gosh, like you pick something up, like calm down. Like calm down, like it's okay, like don't be too excited, like, you know, reflect, like I'm trying to like regulate with him. So if he was like calm and quiet, then I was working on my own regulation. And I felt like that a lot of it was me working on my own regulation, my own discomfort of where I was, because he was showing up every week just, you know, fine with wherever he was at in that moment. Then he eventually started shooting different things. I think it was maybe month 5 or 6, he would shoot different things. And he would shoot it and then he would look at me and I was like, oh, you were wondering if I was looking, like I saw that. And then he would like kind of smile a little bit and then he would shoot something. And then eventually when he would shoot things, he would go and he would pick it up and then he might press something. And then he would go back to his spot and he did that over and over again for months. Then eventually he might say like one word to me and yeah, and then before you knew it, he was tying me up and we were doing trauma work and I was a victim and I was like all kinds of stuff was coming out and he was yelling things and big emotions and I was like, trust the process.
I think when we first start out, we get so uncomfortable in the silence, right? Because we're therapists and they're supposed to talk to us and we're supposed to talk to them and give them insight and help them explore their feelings and thoughts and emotions, behaviors, right? So when we have students come in, they're like, man, I was in group all day and like nobody talked. And I was like, and yet I bet when you come back tomorrow, they're gonna be like, you remember that thing that you said about the whole, I'm not my chicken, like I got it, right? And you're like, see, they were listening, right? Like you can't help but be drawn to want to hear what they are thinking, but they can literally do whatever in the space and you can figure it out because their behaviors are going to be like, when it's really quiet in the room, I like to start doodling or doing something that's going to draw their attention. I've gone in and been like, they want to be quiet. I'm going to put on this movie, right? And so I put on this movie and then all of a sudden people are crying and be like, all right, so this somehow spoke to them in some way, right? Or they're laughing or, so they have some capacity to show some emotions. They're not just sitting there like, a lump on a log or whatever. But anything, I mean, as adults, I've gone outside and I've been like, we're going to throw water balloons at each other. And they're like, we're going to do what now? And I'm like, that is what we're doing. We're throwing water balloons at each other and we're going to talk about our anger, right? Fawn breaks plates, right? Oh yeah, we have a great time at the hospital.
Yeah.
So just getting out there and like, so I do Taekwondo. I'll get up and just start stretching, right? I know it looks weird, but they'll eventually be like, what is happening? Can I do that? When we're talking about kids, if you're doing things like, like head, shoulders, knees, and toes, right? And you're just stretching, they will eventually get curious enough about it to be like, what are you doing? Can I also do that? Right? So that silence gets a little bit scary, but you learn actually more when it's quiet in the room than you do if they were talking. A lot of the kids are just talking because they feel obligated to say words. So then is that the truth? Right? We're not really exploring into that much, but if they just come in and they're like, blah, 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 but they're not even making eye contact with you, that's what we're looking for, right? Like those types of things. So I've come out of groups a ton of times where like nobody talked, but it was still good. Self high five. Let's go. Next day. Yeah, like you got to celebrate those things, right? It's going to get awkward, but like what Sandy was saying, uncomfortable for us. And if it's uncomfortable for us, then we are going to present as uncomfortable, which is not going to make it comfortable for them to start opening up sooner, right? So then we just need to be authentic in the space. Well, if you're just going to sit there, that's cool. Do you mind if I color? I'll put out some different coloring pages, and I'm going to color. And I will be super ridiculous with it. I will color outside of the lines just to get people, get them to draw their attention more towards me to see I'm doing this and get curious. Because if they all say, what are you doing? That's my opening right there. All right, I'm in, you started talking, right? So being a little authentic to the space of just like, can I get their attention? The kids shooting guns. Like, what are you doing over there? I see you're doing something, right? I mean, she could have started doing that. She could have been like, I'm gonna take this gun out and just start shooting things, right? And be like, what's going on here? They get curious and they can't help themselves. So they'll eventually start talking.
Be yourself. And whatever that looks like, we're always modeling, our own regulation. So if you're uncomfortable, do some deep breathing. If you see them, breathing, just, I notice your breathing or I notice it change. Like, with my kids, if I see it, I will, in the playroom, I'm just modeling through like my body language and my breath. It's quiet and just showing them, this is what it looks like to calm down. This is what it looks like to feel angry. This is what it looks like to express sadness. And so much can happen without having to verbalize it out loud.
I want to say thank you all so much. It was so nice to hear you all experience, and thank you for sharing your knowledge and wisdom. It was a great conversation. So I'd say maybe a 15-minute break. Is that a good enough time for everybody? And then when we come back, we'll start our training.
Okay, so 15 minutes and then we'll get started with Ms. Vaughn.
Thank you, guys. Why is everyone anything? I'm doing research project right now. So if your staff is looking for anything about processing vicarious trauma, if you want something more gently structured approaches, we're pioneering things to bring that business model into the. There's a couple journal articles.
Hi, Miss Susan. Thank you so much for joining us. You can stay. Can you hear me?
Yeah.
You can stay if you would like, or you can go because the panel's over.
Okay.
Then if you can just fill out that paperwork for me and send it back to me.
Okay.
I'll keep you updated on the process for payment, okay?
Okay. Thank you so much. I enjoyed it. Bye-bye.
The therapist. is just vital. So it also is a reminder that there's going to be changes that occur in your life as you become a counselor. Most people who are drawn to this field are drawn in because they're not afraid of God. Whether it's their own experiences or somebody that they've cared about, they've seen darkness, they've seen light, and they say, I also want to be that source of inspiration and hope. We're told as students to instill hope. How do we do that? What does that look like? So the other thing that you're often taught as students is to be authentic. Okay, well, how does that show up? So it can look very different based on your theory, your setting, as you saw in the panel. Ultimately, though, again, we're taking you with us. So as we move through today, I do, again, want to make sure that if you feel the need to say anything, share anything, tell me push pause, I will happily help. Other thing is, as you guys can probably sense, I get very passionate, I get very excited, and sometimes I talk very. So you're like, whoa, 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 like back it up, like I can do that too, because I know that I do get very like, kind of thing. A lot of people think I'm extroverted. No, I don't like deeply introverted. I just absolutely believe in y'all, in our field, in our clients, and really in our community and the world, that it can be a lighter, brighter place. And then I go home and say, it's all done. Okay, so let's see. So today, these are our objectives, because of course, any theories that we do, I want to make sure we're grounded in evidence-based practices. There's quite a lot of people out there that are competing for your client's attention in the sense of life coaching and such. And so while these are also valuable modalities, what sets us apart? We are getting these degrees, we're paying for licensing, and it's because we are doing things that are evidence-based. Everything that we'll be doing here, trust me, I can like spin it to a theory. So as much as there's hopefully fun things in the room, these are what we're going to be going off of today. You'll notice that quite a bit of it is actual human development and child psychiatry. So be brave at times. And if there's a theory, something that draws your attention and you say, this is a way for me to show up authentically in the space, do it. Right now, we're pioneering research on utilizing a business model of the 6 thinking hats as a way for cognitive complexity for LPC-Associates. We're building off of a research project that had been published on using the 6 thinking hats for students. So there's lots of opportunities for us to, again, cross over with different fields in evidence-based practices. Okay, so the first thing I want to support you guys through is breathing. And I think that sometimes in our profession, that is either the underdog, we kind of forget to just pause and breathe, or it might be oversold. I don't know if you guys have had experiences yet where people say, I was having a panic attack and I went to the ER thinking it was a heart attack, and they told me to just breathe. I kind of wanted to punch them. And so it's that opportunity to say there are moments where our clients might not be able to breathe because they are in an adrenaline cortisol response, and being able to say, so let's capture those moments where they can breathe as they ride that chemical wave and come back home to their bodies. The other thing about breath work is that for some of our clients who have experienced trauma, abuse, or neglect, connecting to the body could be triggering. They aren't sure how to safely connect to self. And so by being able to role model breathing practices, we're giving them an opportunity to be what I call safely triggered. We're getting consent. Are you open to doing some breath work? And then we're providing them the opportunity to co-regulate by having a stable nervous system within ourselves for them to co-regulate with and through. So I'm going through, because we're all learners here, I'm getting certified in something called heart math. And it has no CEs, unfortunately, for our licensure, but that's okay. And it is research now that is decades deep on heart-brain coherence. And we know now that the heart sends information to the brain electrically faster than the brain sends information to the heart. So if you guys are in settings working with clients and they can't quite come up with the words, the vocabs and those feeling wheels and such, remind them and yourselves that we can still have these felt sense language. Hot, cold, tight, open, fast, slow. And breath work is a way for us to be able to get that heart information managed in a more intelligible way. So at the end of the day, my bias, and again, I'm happy to be called out on it, is I think there's only two skills. Pick any theory, pick any modality, it's either going to be top down, starting from thinking, and then the body responds, or bottom up. The body is led through an intervention, and then the brain follows. So have you guys heard that language, top down, bottom up? Excellent. Okay, what are you guys learning about this that I can build forward on?
It doesn't seem like we ever really go too in depth with it. I mean, we bring it up and just kind of that blanket definition of like what it is, right?
Sure. Okay, well, then I guess I'm glad you're here today. I'm like extra glad. Okay, yeah, so bottom up is what breath work will be doing. And the little acronym I have here is yourself, because again, my bias is you guys are the most important intervention to be able to offer to your clients. So your own strengths, your energy, your lived experiences, and then that forward focus. So what we're going to be doing activity-wise. Yes, okay. Just organize myself. Oh, wait, no. Is in a few minutes, we'll be doing some music and some art interventions. And instead of doing guided breathing, I'll just encourage you to know this and know this. So as we start today off, I want to have that intentional space of our breath will be paid attention to throughout. Okay, so has anybody heard the term neuroception of safety? No? Okay, cool. So Stephen Porges, polyvagal theory. One of my favorite quotes is safety is treatment. So since you guys are not my clients, I can show you personal pictures. And so that idea of all of us have these lived experiences, strengths, energy, lived experiences, forward focus. So some of my lived experiences as a mom of 3 littles, safety was very, very important. And so neuroception, how you perceive the world through the lens of safe versus not safe. And for some people who have experienced trauma, abuse, and neglect, that little scan of safe, not safe has been altered. And so when Sandy in the panel interview gave the example of the 6-year-old who didn't talk to her for months, his meter of what was safe versus not safe needed some fine tuning so that he could start verbalizing to her. So he could pick up that nerve then and start shooting things. So this is where we know we've got mirror neurons. We have all these different ways that the body and brain are trying to identify safe, not safe. And so that term neuroception of safety is what you're providing. So when you come into session and you feel rushed because you didn't get a good parking spot and maybe you did too many monster drinks or any of those things, your client's going to pick up on that just as my little bitties could pick up on how I feel, so too can your clients. And the more traumatized they are, the more those antennas are up, trying to figure things out. So even if it means that we leave home a little earlier, I encourage all my clients and my associates to stop at yellow lights when you're driving to get to work. Do not go like this and practice deep breathing. The average red light in America lasts 2 minutes. So if in the course of your day, the only form of self-care you can do is drink some water and stop at yellow and red lights and practice deep breathing, you are doing phenomenal. So how this impacts our world is fast forward about 17 years or so from this picture to this picture, seeing 3 kids, obviously a lot of time has passed, and they're helping the domesticated mammal feel safe. My family, coming through COVID, one of my ways to move through burnout, because I think a lot of us experienced burnout in various degrees, especially us who were, like not quite frontline, because I wasn't in a medical floor, but I was working inpatient and, had to mask up, scrubs. COVID was pretty rough when we didn't know what we were being exposed to. And I had tests every week for like, I don't know, a year and a half or something to see if I had COVID, because that was part of the requirements for being a state supported living center counselor. So COVID was like very impactful in that sense of what is safe versus not. And so we started fostering cats. We currently have our 72nd cat, I think. Her name is Hope. We'll see where she lands. Obviously it's not a ton of cats at a time, but it's more like 3 or 4. Right now, again, it's just the one. But they've gone to 7 different states so far. And that is an important piece of your person of the therapist. Who are you going home to? And where do you find meaning and enjoyment in life beyond this profession? So that when you show up, you're showing up for your clients, not just to feel efficacy in your personal or your professional life, but to feel efficacy in all parts of your life too. So this is Cleo, and we found her in Hazel Bays Moore Park. She is now in Maryland, and she had tons and tons of fleas. So again, that idea of neuroception and safety. As you provide and teach people safety, then they can be that future focus of providing others safety too. But earlier today, when I said your presence is sufficient, I hope to embody that truth. And I hope that you empower yourselves to believe it. 5 human needs. So Boynton Glasser, out of choice reality therapy. This is something that is a lovely grounding practice for a lot of my clients to kind of wrap their heads around and say, it's okay to be a human. So the title of this presentation included being needs and doing needs. And our society really values the doing needs. What are we doing? You guys are in school. There are so many doing needs. And so to say, okay, where are we creating opportunities for some of the being needs within that? And so my hope today is, even as we're doing the things, you get opportunities to also pause and just be. So the different exercises I have for you today, it might invoke some performative anxiety or expectations. This is just for you guys to do with it as you choose to do. But notice that within yourselves, because there's going to be interventions you offer to your client, and it too might elicit some performative expectations. And so as you practice being kind and silencing the inner critic within yourself, you'll be able to more organically offer that same compassion and grace to your clients. So this also can hold us accountable So when my clients come into an outpatient setting and we have to assess for suicidality every time we see them, is if they do not desire to have a pulse. All of this is meaningless to them. They have anhedonia and so forth. Then, okay, we're having a conversation and we're walking up to intake and they're going to get inpatient level of care. So the other aspect again is to both empower people to identify that they have needs and support them meeting those needs autonomously, appropriately as they can. So any questions? Does this look familiar to you guys? Go over human needs? Okay. Anybody utilize it in any of your settings yet? I'm not sure. Is anybody here in field work? Yes, yes, okay. Anybody use this theory or not quite?
I think in one of my sessions that the energy level was kind of low, so I just pulled out like the tool that we used in one of our classes, the counseling theory class. We had like the tubes. And I was like, just like color in like where you're at today, because it's kind of like a Likert scale, but it's less for me directing it. So I was just like boring, tired because like this is not being met, but like I just wanted to see where you're at.
So again, if you ever feel stuck, go back to your theories. Your theories have your back. So as we go on, let me double check myself. Yes. So as we now transition to our first intervention, I'd like you to just kind of in the back of your mind, let your subconscious kind of roll around with some of these ideas. And when we do the debrief after the 6-minute song, we'll come back to this and see if it elicited anything. And if it didn't, that's perfectly fine too. It's just to allow yourselves to remember that that subconscious is always working and to give yourselves and your clients credit for the effort it puts forth. Okay, so people who are joining us virtually, I'm going to encourage you to get paper and pens or pencils as you have access. People who are here in person, who have paper and oil pastels, we have chalks. And there's a reason why we're using these in particular is they're kind of not very forgiving. So anytime you do play, anything art-based, Sandtray, of course, is one of my home comfort places. It does elicit the voice of the inner critic. And this is a beautiful way for you to support your clients, befriending their inner critic. I do a lot of mindful self-compassion, theoretical work, by giving it voice in these non-threatening settings and then figuring out how to work with it. So if the art leaves you feeling uncomfortable, that just means that you're in the right space.
Yeah.
And it's expressive artistic depiction of this music. Okay. Let's go back to that slide briefly. And are we noticing any of these themes organically emerge?
I was just like rolling, like I wasn't trying to make it look nice and neat.
So freedom, independence. Freedom, exercise power. Power isn't always a big demonstration of power. Sometimes the power is getting up and grabbing the light. You have the power to meet that need.
Yeah, I think in a way, like whenever you pulled this slide back up, that was the first one that came to mind. And I don't know, it was funny, just as I was drawing, just stuff related to like waves and kind of, I don't know, like ripples. And then I just had the urge to like draw a train. And I, like some of the other like little waves that I drew, I was like, oh, it seems like that could be the tracks. Now, there were a couple times this week where people were asking, oh, how's it going? And I'm like a little engine that could, just keep on going, and I don't know, it's some kind of empowerment with that.
And it's such a great example of how the subconscious continues operating even when we're asleep, right? We know this. And so that's where we get to some of those no wonder statements. Well, no wonder a train track emerged. I've been the little engine that can to get to graduation. And then we're the little engine that can to get through the NCE. And then right, the next hoop. So you're like, okay, I made it to this station. We're going to get to the next track. Yeah. And so just allowing yourself to be like, yeah, body and brain, we got this. We're on track. That's, yeah, beautiful. Great example. Anybody else willing to share their image and kind of what emerged for them? Okay. You want to show your picture?
I don't know if I want to share it,
Okay.
but that'll look good.
Oh, please. Oh, okay, go for it.
I thought a lot about belonging though, because each of the parts sounded like they were separate and shouldn't be together, but cohesively they were one song. And when they started to mix, it made a lot of sense. So I thought that related for me personally, like belonging, like sometimes we're all just different sounds and different people with different backgrounds, but like we kind of just go together and it works out.
I guess kind of thinking about that, like when I'm hearing it, like, I don't know, I guess some of the sounds like brought up, like, it was like uncomfortable to hear that. So I don't know, I just thought that was weird where, like, I was able to notice, like, different sounds bringing about, like, different feelings of feeling, like, uncomfortable or, like, oh, I don't like that. Or wanting that sound to stop and then, like, feeling really good on, like, okay, that sound stopped. And it's like, so a sound I could, like, tolerate. Yeah, excellent. So if anybody resonated with that, some discomfort, some of the aspects of the music is something to consider, because again, these are parallel processes. As you guys practice discomfort in your own life, you're going to be able to better support your clients moving through their own discomfort. Or at times we tell y'all, sit into discomfort, and that's kind of what you did. So for you, did the discomfort show up in your tummy, heart, or head zone? So we know we have brain-like cells in both our gut and our heart. All right, so it was like more of like a chest thing. It's like feeling it. And so then if you were to continue working on that, then that might be where breath work could be really empowering for you, because it is opening this area. Or even just a shoulder roll. I rarely tell my clients to take a deep breath. I usually like invite them to roll their shoulders. And you'll notice the breath just helps. So what helped you, and anybody else, what helped you guys tolerate some of the dissonance? I guess like
moving, like I guess like the drawing or like the different mixing of colors like distracted me. Doing different, I think I don't remember, but when like those weird sounds, like I would like do like little, I don't know, movements, I guess. But I guess with the, mixing the colors, like distracted me.
Excellent. Anybody relate to that? Did you notice you drew differently based on what some instruments were playing?
Yeah.
Yeah, anybody? Okay, tell us about yours.
Yeah, so mine's very colorful and there's a bunch of different shapes and patterns. That was like hearing like different parts of the song. Like, I don't know, when I was drawing, just like maybe I heard, I don't know exactly what instrument, I'm not like musically person, whatever music person, but like certain things I was like, whatever, like, that is what it sounded like to me. And when the song started playing, I wanted to dance. And so there's like supposed to be me in the corner because like I'm like expressing with my body.
I saw that. I was like, she was doing. I was like,
Yeah, like dancing.
so some bilateral stimulation is what I'm hearing is the moving of the body, the moving of the art medium to align with, to have that coherence. As is within, so is without. As is above, so is below. There's these coherent matchings that occur. And part of why we do things like this in therapy is because your clients might kind of inadvertently be matching and aligning with unhealthy situations. We know in our culture, people will use the word toxic almost too much. And to say, okay, well, let's actually identify what is your body or brain or heart aligning to, such that it's impeding function. That we can now create other opportunities for alignment. And art and music and such is a great way to get that alignment going. Yeah. So any other thoughts about this exercise?
Yeah, there were times where I was frustrated because like I've never been a very artsy person, or at least artsy in terms of like drawing, painting, stuff like that. And I was like, man, bro, I'm not drawing at all. But at the same time, it was just like a reminder, I guess, of like the freedom part. Like, all right, bro, like it doesn't really matter. Just do it. Like silencing the inner critic part. But yeah, that was just something that I noticed. I want to be able to draw like what's in my mind and just being okay with it.
Excellent, excellent. So again, as you guys have your commitment, acceptance and commitment therapy textbooks, these are some of the ways of building bridges to self-acceptance. If I can practice this tolerance skills and self-acceptance in an art piece, then maybe I can better tolerate it when I'm in HEB in line and I have social anxiety. Or I have a job interview and I'm being really down on myself. So again, these are opportunities that as you guys practice this in small ways, you can offer it to your clients and then you amplify it and say, okay, do you remember when you did that train track and you had the positive mantra about I'm the little engine that could? Okay, so how can we continue that forward? So that ultimately you're helping your clients create their own affirmations and mantras that reframing negative thoughts to positive thoughts, if we want to go CBT triangle kind of stuff, to then take that positive action and stay vertical. Stay out of my place, the hospital, just keep going and be okay. Yeah. So there's lots of different music out there, and you guys can find research that says different types of music, different particular songs can elicit different responses. And so I encourage you guys to have a couple of those tools in your tool bag, because ultimately, as today's theme is about play, is if you watch a little bitty baby dance, they are not being down on themselves, are they? They're just feeling that beat and moving. Or we've seen videos, or maybe you've seen it in real life, of dogs and cats and birds bopping along. So it's getting that nervous system, and this is a bottom-up practice. So as you guys maybe had some of those negative thoughts, that top-down occurring, the bottom-up practice of focus on the music, focus on the beat, focus on the drawing, was able to then get the mind to quiet down and that inner critic to shh, just a little bit. The music is a wonderful bottom-up practice. Okay, questions, comments, concerns before we move to the next part? Are we good? Okay. Okay, so earlier today, you had heard us talk about ACEs. And I think that this is one of those spaces that we know there's going to be interrupted developmental experiences. And that's part of where they come see us, is something like sideways. They got off track, if you will. And so we're coming to help them get on track again and attune to themselves, while also recognizing we can't change the past, but we can support a more aligned future. So it's important to have this in context, not to be fatalistic, but to be informed. So any question about ACEs and how it might tie into play? Okay. So if questions do emerge, I can always come back. Maslow's hierarchy of need. Do you guys remember this guy? Yes. Okay. Why does this still exist? Like, this is from the 1950s. What makes this a useful tool still?
It's because if certain needs aren't getting met, you can't talk, like, it's gonna be hard to talk about depression if you don't know where you're sleeping for the night. And one of my sites, we work with the homeless community. And so if there's needs like shelter and showers and food, that aren't being met, it's kind of going to be difficult to talk about your feelings because there's other priorities that are just being ignored.
I agree. Let me just say about that. I'm like, filter. Yes, yes. One more person, you guys seen evidence of Maslow's hierarchy at work in your site or with your clients?
So like going back up like one of my things, it's more of the stability and security part. It seems like that is the cause why she feels alone and lack of support. So immediately, like my thoughts are like, what resources before we even tackle talking about her feelings? Like, what resources are you needing? To get this need met. So that's kind of like getting the basic needs and the safety met before we even talk about her ideal self or where she wants to, go into therapy.
Yeah. And if we were to put the 5 human needs template over this, if there was a juxtaposition, then it's like those 5 human needs need to be met within this level. And then, okay, we need to revisit them again here and again here and again here, because they're going to look so different. That ability to have the freedom and independence to draw an art piece, that's going to look really different when it's here versus here. This might be, I'm doing telehealth with somebody like in our case study, a middle-class family that I could send mom the supply list and say, okay, we're going to do some art with Lena. And it's telehealth because she's in the hospital getting treatment for lupus, and this was an appropriate way to do this. Compared to saying, okay, we're helping at the women's shelter, which I'd done a couple years ago. I got trained in, it's like Rainbow Connection. And we would teach moms in homeless shelters how to play with their kids with no resources, because we're looking at bonding and attachment. So again, back to the 5 human needs of love and belonging, which sure, that's up here, but actually it's also down here in the sense of it's still a need. And so we could be in a homeless shelter, and a quick little story is old school newspaper and masking tape. You can make hockey sticks, goalposts, basketballs. Like, we made so many different sports-based kind of, obviously, easily destroyed. It's just paper and tape. But it was a way, again, to just create that sense of fun and connection, even in a place with minimal resources. Why is this important? Because we're mammals. That bit of oxytocin, that laughter, we're getting some serotonin and dopamine, and being able to feel good together and practice what sometimes temporary safety might look like. In this moment, you are safe. Here's the masking tape, here's a newspaper, let's make hockey sticks. And for you guys, you know, hopefully, even though you felt the dissonance of some of the music and maybe we're thinking about school and some of the other stressors, you were able to allow yourselves to compartmentalize in a healthy way and just have just play. Excellent. So yes, when as a supervisor, when I work with associates that are feeling kind of stuck or overwhelmed with their client's case history, I'll often go back to Maslow, or I'll go to Erickson's or Colberg's. Colberg's great too. Okay, so our next intervention. So I have set up on these three tables, three different games. So we have the marbles, we have a game called Rush Hour, that I think more people play it on their phones now than they do in actual real life. And then I have magnetic blocks. Now I chose these items and I do use them with the intention of creating frustration and distress. I always get my client's consent and say, do I have your permission to possibly frustrate you or irritate you? And are you willing to trust the process right the way through this? It's fascinating. Most of the time, I'd say 90% of the time they say yes. But it's also because I create therapeutic rapport. Before I do a withdrawal from the relationship, I've made sure I've added enough deposits in that therapeutic space to say, we're taking our risk. Are you willing to do this? So what I'd like you guys to notice as we kind of go along is play elicits both verbal and nonverbal responses. Also, this type of play, there are rules. The marble maze will only fit certain ways for the marbles to go through the chutes. So there's times where my clients, especially if they have OCD, OCPD, or they're getting really rigid on things, is we will do these sorts of games to help them understand you can make mistakes and it is okay. And also there's a lot of vulnerability in connection and play. How do we amplify success? And how do we forgive mistakes? So what I'd like to do is for the next 10 minutes, and people who are online, if you have any kind of card game at home or a game that you play on your phone, allow yourselves to have these 10 minutes to experience that. Again, noticing how that inner dialogue is and what body cues come about if you made a mistake or you did something wrong. Because again, these are the systems that our clients and us are taking into spaces that feel riskier, where there's more at stake. So, you guys are welcome to stay in your table groups. You're welcome to move up. I can around and provide support as needed. But I invite you guys, as you're ready to stand up, migrate to that side of the room and choose a game to engage in. I will be your timekeeper.
out in the parking lot. And we'll put the car out. And we'll make the parking lot. That car, and put it in. Marvel has so many people, there's not enough genetic time, so I'm here. I guess like in my head, getting frustrated when I was meetings, like when I had to be frustrated. It's all the things that are frustrated. We got frustrated when it's like, and then they're not trying to it's sometimes because some of what you guys call the other person saying or saying, I are in my head. And not with that attitude. Texture. The other thing is you guys did have a spaceship. I heard that. So again, part of this is we're being makers. We're making meaning out of our life. In this case, it's something low stakes. It's magnets and carbon. But again, that's what we're looking to practice in small ways. That and we can handle it when it comes bigger. Support our clients and then find small successes so then they can practice it when the stakes are higher outside the session. So the other thing is these are finite. Right? Each part of these toys, these are specific compared to other things that I set up, is because it has a limitation, and the limitation is outside your control. The magnets aren't strong enough. But there's also times where situations, you, your clients, all of them have to carry stuff. Because we're working smarter, all the things, and make it work. It is literally outside our control. So, how do we know this? Some states in the game, I was more forgiving of myself for making mistakes and making mistakes with progress. And normally I don't like starting things with habits or important. Like we could just start this over because I think it's all that stuff at this point. So I'm just giving myself permission to make mistakes freely and start over. It's not like we're not like really a lot of it.
Yeah, I mean, my approach is just, let's just see what happens, move stuff around and see what works. Yeah, very mostly.
It's super collaborative, right? You're only supposed to play like all three of us were like beating off each other, like we move it, like, oh, that didn't work, but we didn't know that until it did it. So like, let's go ahead and take a step back. And like, we just try to problem solve it. Yeah, we built a little too much confidence too fast. Yeah, it worked out.
So again, you guys are seeing those 5 human needs in your safety conference. It started off more individual and it became collaborative, resource community. And isn't that part of what we're thinking of our is to do is for help, receive help without guilt or shame. And so that's some of the things that I heard you guys say is moving this progress. Oh, another one was now.
We went from the first level to like the last level. Yeah. Yeah.
Lower stakes, you guys were taking those risks and creating your own rule. But then, something that says, to help people verbalize things, can give you really excellent value. A lot of times, I've noticed with my clients, they'll be more affirming of other people, but then they're really down on themselves. And so I'm able to amplify that and say, hey, you were able to see things to your partner, but when you were struggling really, you know, you were saying something really negative about yourself. Are you aware of that? You do have a skill. By naming and start practicing talking to yourself the same way you would a friend. Again, that's my theory of mindful self-compassion. One of the key tenets is kindness, not criticism. Anytime you guys get some of the marble runs, they're pretty cheap on Amazon. They're great, like they're great for teaching Maslow's hierarchy. And so there's times where with my clients, I'll get their consent, just like Sandtray, anything that once that field of play is in their bubble, it is safe. You do not go touching or digging in. So I ask consent and say, okay, if I move pieces. So, and I'll say, especially you guys that are working with homeless populations and such, I'll say, you have some alcohol last week. You were really struggling and we're trying to get housing and you were disappointed that it wasn't free. And so without that housing, you feel like that's where you lost your marble. And it feels like everything just got filled up. So what can we do to rebuild, knowing that housing might not still be good, but we gotta get to the shelter before it closes, so you have a bed. What can we do to support you getting back on track, being able to stabilize? And they're like, well, and they say, okay, I really need to do my sponsor. I should work with them and say, okay, so meeting your sponsor, going to a meeting, I'll give them this credit, like, we're actively using this as a living metaphor. You make an appointment at the Social Security office, you got your bus pass, and you're gonna get your Social Security card again if you lost it. I don't know, now you're going to Marvel and you're going to your meeting, you've got your Social Security card, you're moving forward. And it helps them see it in the field. So is that making sense? And you could do that with any of these, you know, you're taking on, go back to that case study of Lena and Lucas, and she's 8 years old, and I was like, oh, when you're taking on too much, the spaceship crashes. It can't tolerate that much weight. So what can we build that is small? What's the smallest improvement we can make? Well, okay, maybe it's taking her meds at morning versus night or vice versa. And then you're helping Lena actually construct and say, see, this is more stable. And over time, you will get stronger. So is this making sense? So you can use these as living metaphors to help their brains process differently. Excellent. Any questions about this part of today? Or any feedback? What do you say? What do you guys do with clients? Feel acceptable? So you ask permission, like, okay, I have something. I kind of have to manage what to do. But also, I let them know, I have your back. I'm always here for you. And so sometimes we're like, yes, you're good. And we're setting the level of action. But that's on this way, I would look at but the steps to solve the problem are on the back. Yeah. And so there's times where I'll say, okay, we're going to solve the problem. And anybody who's gone forgotten and stuff about perpetual problems versus solvable problems, that there are unmanageable things that you've got to learn how to tolerate that. But within that, that's something that is that. Think about give yourselves credit for a value you might have in life.
by doing this exercise just naturally and choose a card that either has an image or a word choice on it. And then we'll return to your seats with the card. And for anybody online, you're welcome to look up values lists. Values lists can be really helpful. If you click on images, sometimes there's fun little depictions of what those values are, and it's a great way to anchor an experience.
And these values just relate to with what we just did, specifically for that.
First, yeah, and then from the first time, it's like maybe I was still green here, I think my bus passed. And I was like, yeah. So it was like a really good connection. After like not wanting to talk. And then like finally being like, yeah, like I think I'm gonna feel great. Whatever. It was good. It was a good moment. Sometimes we just like there's papers or like what's your weather forecast today? Oh, see, I've never tried that. Weather forecast is good. Colors are good. Mark rockets. Fantastic. Has it working in the color? And green and fire. No, yeah, like that. I was just kind of funny how, you know, what I would be able to go inside for. Yeah. It's like the things you wouldn't expect to see in the show, like inside.
Play with the science, and I started doing that.
We want more of. Yeah, really. Yeah, because I mean, you're going to social security office, do all these things, and so I think it's also just like hearing people out with their current situations, because other people have other things going on, and like something as little as getting like you're 18 might be used as something different, but there's so many limitations without your identification. So it's like also, how long average are like your clients like inpatient? 7 days. That's what it should have. Yeah, it's still crisis standard. Because I'm over at pathways, and so we get a lot of baby. You're a baby right now. We get most of the baby. Yeah. So, and ours is also short term. Yeah. So it's like a big change that you can see from like beginning of that. Oh yeah. Right. Okay, folks, so if you haven't started already, I encourage you to take a minute and share that value with the people at your table and give yourselves a moment to first and give yourself embodying these values. I like that.
So.
No, I probably would have been done with it. Because lost interest, yeah. Even like times I was like,
Pocket.
and I was like, yeah, let's go.
So that community help.
Yeah, very common thing though.
I'm sorry, were you done with community?
Go ahead, go ahead.
Alright, well, I guess this just. I chose patience, so. Ability to withstand, I mean, like, okay, so I don't know if y'all noticed what that game was, but it's like a bunch of cars set up. Cars can only go backward and forward, and some of them are going towards the left, some are going vertically, and then you have to get one car through a specific space, like a specific car, like out of the. So when you do that, you have to put all these other cars around, there's like limited spaces, so you have to, one car, move another car, and then you have to back up. So it's just a lot of moves and just trying to figure it out, so. So, yeah, it's just like being patient with like, even if I move every single car in the present time, that's probably not gonna be enough to move the. Three different times. Yeah.
Okay, so as you guys are exploring values, any table notice a common thread between the values chosen?
How are you including?
We both kind of have to comment of like, it's like you're needing to but that will be better out.
So this table identified optimism and persistence as having like a common thread of something to be difficult and yet we can work through it together. Excellent. So again, part of what's going to happen is you and your clients' values will start to align. They can be totally different values, and yet there is an alignment, and that's part of their building therapeutic rapport. So what about this table? Was there anything that you guys would say is kind of like a common thread to your values that you explored?
They both had community and inclusion, and I had patience. So I mean, their two is like definitely interrelated. I don't know, maybe mine is kind of the undertones of both of those, just like being patient with each other, like being patient with the activity now that there's community and inclusion.
What do you guys think?
Yeah, that's kind of what we said, like, it can be hard to work in a group setting if there isn't patience there. And kind of like picking up on what other people are gonna do. And finding your role in that.
That's excellent. And like, you guys are actually probably looking this out in school group projects and stuff too.
Yeah.
There's, yeah, a lot of that dynamic. What about over here? Any commonality that would be this together?
That's that maybe it's like the connection is communication, because a lot of us have like collaboration or being within parents, you know, within this big structure. You can't structure without discussing boundaries and rules. So the communication part.
So these are our values, then that opens the door for your clients, even little babies. That's why there's pictures on the cards and you can find more useful values cards for little kids
especially as ACT gets more widespread, some of these more modern theories to inherent values, is to say, okay, what is one of the values that you want to practice in session? Obviously, that can be a really overwhelming and maybe too broad a question until you know your client. But then we're able to start giving them that feedback. So if you say, oh yeah, I value communication, I have family members that have all these different values, and yet at the end of the day, we all value communication. Then it's like, oh, okay, so when you go do that risk-taking thing of build the marble run with your family, sounds like communication is going to be one of the values you practice. So again, now you're using their words, their choice of what to focus on to validate what they're then doing outside of session. So is this intervention making sense? Yeah. Of course, we can do all kinds of different things around values. I think it's one of those topics that can be either sometimes overlooked or maybe focused so heavily on that people can also burn out. I've had some clients where they're like, don't ask me about my values again. I'm like, okay, that's fine. So use any of these tools based on your gut. You're in the room, you know your client. So Vygotsky, why are we reviewing some child development stuff today? Because again, anybody who's in your care, something glitched. And typically it's during developmental stages. It could be a big glitch, it could be a small glitch. If anybody remembers the 3 E's of trauma, it's that there was an event, people have an experience as a result of that event, and then there's an effect because of that experience. So with Vygotsky, we're bringing this into play because more and more of the clients we're seeing, their play has been this. And so they're missing this wider view of the world, and it's almost like a 2D world. There was a clickbait article. I didn't click it, so don't hold me accountable for it. But it said something along the lines of the little bitties might be the first generation of humans to start losing language skills. Because if all they're communicating through is essentially emojis or just messages, is we're missing some of the richness and depth of our language, of the spoken, I don't know what to say. Just keep rambling until I figure it out. That our language helps us think because it frames things in. And so if our language becomes limited, they were postulating that our thinking could also become more limited. So Vygotsky talks about tools and technology, and obviously he predates our idea of technology. So in this idea, technology really is any mentor, anybody who is helping you learn the lesson. So we start off as not knowing how to do the thing. And depending on what site you're in, you're going to potentially at some point be seeing a lot of people that are struggling with adulting. Now, I'm of the generation that you are an adult. You're an adult. And so I remember one of the first times I saw a shirt that said, I'm done adulting today. I remember thinking, that's possible? Like, yes. I can actually stop adulting for a while. That's so great. So I do think that there's opportunities for those boundaries and for that play. But it means that I've fulfilled my bias, my values, safety and respect. I fulfilled my responsibilities to then not have to be so intense in the adulting. The challenge in finding is a lot of my young adult clients, they don't know how to adult at all. They're really struggling with how to make a phone call to get their meds refilled. Some really fundamental things they're not sure how to do. So then we come along, we provide mentorship, and we're saying, hey, try it on for size. What that looks like in my setting is saying, hey, I'm going to be in my office doing some paperwork. You're welcome to come in there and do those phone calls. And I'll be a support. If you're not sure what to say to the pharmacy, we can talk it out a little bit.
so that we're role modeling for them how to exist in that adult world, if you will. And then the hope is with practice, with safety, then that patience, that optimism, communication, all these values you all were talking about, then they're able to exercise greater freedom and independence. So if we take some of the games that we played today, some of the art that we played today, you guys in your table partners were mentoring and helping each other. And then the tools were simply the supplies that I brought in with me. And now you guys have the awareness of, I can do this with the client tool. I just need to get some tools and I can be the mentor. So we are continuing to go through developmental stages. So again, if you start to feel stuck with the case conceptualization, you can always go back to the developmental stage theorists to then figure out what counseling theory might best fit that client based on where they are. Questions or comments about Vygotsky? This is like the briefest overview of him. He's a cool dude. Well, I think so. Okay, and one of my favorite quotes, this will probably feel very familiar to a lot of you guys, Viktor Frankl. So this is what we're creating when we're using play across the lifespan, is there is a stimulus coming their way. And you've already experienced this through discomfort during some of the instrumental pieces in the song, or through self-judgment about the magnets not holding the weight and structure you were hoping they could. So there's stimulus coming your way all day, and then you're having responses. Sometimes the response is a yawn, as this is a long day. Sometimes the response has been laughter, as you're getting connection and community. That is where your growth and freedom is. So back to the 5 human needs, thinking about Maslow's hierarchy, all these different models can be thrown into the sentence, recognizing that stimulus is coming towards your clients all the time as well. And we're looking to help them create a healthier response to that which is coming their way or coming from within. And experiencing growth and freedom in that safe, contained space that is therapy. And not all of us are doing therapy in offices, right? Sometimes it's sitting at a table, hearing about a client getting a bus pass and their mood changed from one color to another. Such a great example is to say, I'm not locked in rigidity of this is what counseling looks like. I'm flexible in saying within my ethical bounds, I'm meeting my clients where they are. They get some growth and freedom, and so do I. So what I'd like to invite you guys to do is think about for a few moments, and we'll also be taking a break. It's 12:27, so we'll take about a 13-minute break. So I'll give you a couple minutes to talk it out, and then we'll meet back here at 12:40. Is think about at this point, how might you use play in some of the different settings that you're engaged in? So again, you have between now and 12:40 to have that dialogue, and also get up, stretch, do what you need to do, and we'll start back at 12:40. And for people online, if you all want to use the chat function and let us know your thoughts about play and how it might be impactful to your work, feel free to use the chat and we'll read your comments when we come back.
Off the recording.
So what I'm going to do is imagine your setting
the one that you're at now, or maybe an imagined one in the future if you're not doing field work right now. And I have these diagonal tables. I have my river cards. This is a deck I have used, oh my gosh, for so many things. My clients absolutely love it. It's an expensive deck, but I've like gotten a return on my investment so many times over. But for your purpose today, the prompt I'm going to give you is imagine that your setting is a spot on a river and conceptualize what that's like. And then we'll debrief that with your table mates and think about what those barriers might be to help that river flow more freely. Or if it already is flowing freely, you've got cards of that option too. But I just want to give a moment for us to pause and identify if there's any barriers to exercising play. Let's get community support to work through that. So as you're ready, I invite you to stand up and choose one of the cards representing your environment that you're currently doing work at or might in the future. And for people online, if you want to conceptualize, you can pull up pictures on your phone or another site of just what that river metaphor might look like.
Is this pertaining to our site?
Mm-hmm. Yeah.
The site and not us, just specifically the environment.
Yes. Yes.
Goodness. What's the little message was that?
Realizing that it's not applicable.
Well, can you make it applicable? No, because I mean, our initial view, right, is that lava is bad, right? But when they say that lava is powerful and it makes it
I mean, that's, yeah, I was kind of having more of like a, I guess a person, like the river was like a personal.
Don't look. Yeah. Don't look at my. Don't look at my river. Yeah. We're going to be over. It's just so long. Obviously, I'm sure. Like, I had another one. And she was for a while. And I would be like, yeah. And that was. I remember having you. She's like, yeah. And I, lots of earlier. They were like, should we train on like? You're changing your mind on lava?
Yeah, I'm actually going with opposite elements, opposite temperatures.
What does that say?
It's like snow, it's like ice.
Does it make you ice like that?
Ice.
Like I can. I can never go back. That is weird though. I was just like real trouble. I've seen you know what a lot of everyone was already.
Oh, I get it.
So she was like, what is that?
Honestly, there's no way I could do it as if you're one level. I'd have to get paid. No, I mean, that's just the way. You just gotta let it adjust.
Okay, so if you haven't started debriefing with your table mates yet, take a few moments to describe the river and get some feedback for what might help you navigate that river. So you can bring play to your science.
My river is like the spiral. But they're comfortable to start by solving rocks. They're safely. And the reason they don't like all the time. In what ways are harmless? So there's like challenge based on the insight. I like struggling and impacts my. Oh, our current site. But it's gonna be. Well, yeah, so I go around. My other side is full. People. Yeah. And so that rubber sword always just one other, but there's a lot of other stuff going on. So kind of just sort of living in that river. And I actually for the same reason. I guess this level is just there's a lot of like validation sometimes people want to and they kind of so I got really this from yeah, so you can just and just to start incorporating and maybe slowly.
Put it back up. I'm trying to click his own workplace. Oh, there you go. Oh, it looked like it down there.
Where?
See? Where's that file slash stop recording? It looked like it.
Okay.
Okay. So work. Okay, babe. All right, I'll see how I'm doing.
All right. No, we were just trying to make sure that it was still recording. But we don't want to go to the beginning. There we go.
I was gonna say in the chat, so I can type in my emails.
Okay.
It's that.
You can do it.
There you go.
Okay.
Have a hard time with one of these or hiding the words that I don't know. Thumbs down. How are we doing with the cards, the river cards, conceptualizing your sites? Okay, did we get any feedback from our group members or table mates about how to navigate the waters? You're either swimming in, sinking in, floating in. Do you guys see how there's times where using metaphor can create some distance and a different perspective language-wise to look at a situation? Yeah, so again, play isn't always just the lighthearted kind of airy-fairy. Play can be used as a modality to change the structure of your thinking. And so just checking in, anybody have any solutions to offer as to how they're going to navigate the waters and possibly try out play in their setting?
Honestly, I really like that rush hour game. Just after we finished it, it reminded me of like a case that my client seems like they think that they're stuck. I'm kind of thinking that like, all right, well, what do I do? They literally said several times they don't think they can make any moves, right? So I mean, that's literally a game about making moves.
Yep.
And yeah, I don't know, I was like, oh, that could actually be really cool to like visualize that internal what's going on. And then like all the little things that they think that they need to do, right? Those are all just cars, that are on there, right? That increase the difficulty levels. So I was like, oh, that's great.
Excellent. Yeah, excellent.
I was saying earlier how like sometimes like the kids that I work with just have a hard time expressing or finding the right words to express themselves, or they're just not used to it. So I can see like how play therapy. I've been trying to like dabble in Sandtray, so and using that with like clients who struggle with expressing themselves or just finding the right words. I mean, stuff like this.
So I'm hearing some bottom-up practices, right? If we go back to the beginning slide, that bottom-up, he feels like he's stuck, and he can't move. So let's have him play the game. Sandtray, and part of the fun about Sandtray is it's different compared to art in that you don't have to create the image. The image is already there in 3D form. So it kind of reduces inner criticism to a point. It's kind of different. And again, those are bottom-up practices. They're navigating the room, they're navigating the collection, and then the thinking follows. Like, excellent. Other thoughts on bringing play to your site?
I was talking about the student in group too, especially with a lot of the population that I work with in group are stabilizing or are homeless and trying to integrate back into the community or just got out of prison. So maybe incorporating games that require steps, because I hear a lot of like, I have to do this and this, or they're like have like tremendous anxiety about where to even start. Feeling like they have so much and just it's too anxiety provoking to even know where to start. So I guess kind of integrating a game that requires steps, and then like reflecting on like how to get to this thing we had to first start with this, and then kind of with the building and the marbles, and that would give to experiment with.
Look at some step-by-step stuff to reduce stuckness. Yeah, what about over here? Anything you can mind about barriers to play or how to navigate? So it's really difficult to so here's what there, but I have
And we'll have an intervention that you'll be able to take paper home with you on the same tray, but it just has to be about sand. And be about having all the criteria. However, let's see, we're open-minded to that. If COVID taught the therapeutic world anything, it's to be fluid and flexible. And so that's what we have these river cards, is to remind you guys to also be fluid and flexible. But also know where your boundaries are. A river has a river bed. It has walls. It has barriers. There's only so much we can do where we still need to stay in our lane as counselors. And yet see where there might be some log jams of stuckness or the swirls to navigate, and then how to move through that. So to be open-minded and say, Sandtray doesn't have, we're not doing sand and play. We're doing sand therapy. And so to say, that doesn't even necessarily have to have sand. And so that's why we're doing the deeper intervention for people today. And that might be something more. Anybody interested in Sandtray certification next year? I do it every 2 years. Very distinctive counseling and consulting. Okay, so those river cards, probably organically, some of these conversations, you guys noticed that you might have been a little low at times, thinking about the struggles your clients face, or a little higher, a little activated, thinking about the struggles. We care about people, and that's part of why we're here. And so we want to have rational compassion, where we say, what can I actually do to have efficacy in the situation? And being able for myself to stay this calm, active, alert person. So checking in, how many people know the window of tolerance? Some, yes? Yeah, excellent. Okay, how would you describe it?
When I think about it, I think like you can only take so much, like the shutters will be closed until like there's enough pressure, and then it opens up to like whatever it is going to be, like some type of explosion. So maybe emotional, physical, verbal, non-verbal, but only takes so much.
I think part has to do with on interest and the window signs like drawings of it. Like I explained it as like, you know, they're almost half of the bird, and then when you have structures like either fire or whatever, no string, and then something just in the over arousal things. So it's great. It's by Dr. Dan Siegel. So again, not necessarily counseling, right? It's child psychiatry, if I'm remembering correctly. And yet we absolutely, as a counselor, absolutely love it. We all use it in outpatient because it's so identifiable. These bodies have their own ideas of how to interact in the environment, how to ride those waves of whatever they're going through. And so there's times where these, if we imagine them also as neutral terms, I'm going to be tired after today. Like that's just it. Because I'm aroused. You guys can see I have a lot of energy right now because again, I care very much about you guys, our profession, and sharing what I have. So it doesn't always mean bad. It can mean excited as well, and it can mean at rest or at peace also. So there's times where I've worked with clients, one gentleman in particular, who he said, my therapist keeps telling me I'm depressed. But I don't think I'm depressed, I think I'm anxious. Okay. Tell me more, right? Your classic, like, tell me more. And he said, well, Saturdays, I just really like to go fishing by myself. And my therapist said, I'm isolated. Tell me more, right? You're like, and he said, yeah, Sunday is family day, you know, lots of family in the area. We go to church, we do the barbecue. Like, he's telling me how busy Sunday is and how his Monday through Friday is really busy. And he said, Saturday, I just really like to go fishing by myself. And I said, like, I'm confused. Where? So then we had a conversation about the difference between isolation versus solitude.
he really was craving that less stimulus, that quiet space of solitude to recharge his batteries. He wasn't isolating, which isolation in this case is further energy draining. He was seeking to reboot his battery because he knew the week and the weekend was super busy and super full, so claim some space and peace for himself. So there's times where our clients also might be kind of mixing up symptoms or historical diagnoses, and you're saying, this doesn't quite match what I'm seeing in the room or what I'm hearing in their story. So that idea of engaging in play also, if you've noticed anybody who started tinkering, which very, very grateful, if you're tinkering with the toys on the table, is, and we use it in Sandtray, we use it in lots of different modalities, is sometimes the conversation is in this space, right? So instead of it being this, right, it's we're fidgeting, we're tinkering, and then they just start opening up and sharing what's going on. So you're able to identify by having items in your environment that are site safe to your setting. It doesn't have to be a bunch of things. I have these available on my group tables every day in women's IOP. I founded the program with a very specific intention, which is to provide something that at one point in my life I would have benefited from, but didn't have access to. So what can I then say? I've learned some things and I want to offer it, you know, ethically and evidence-based wise. And so for myself as a therapist, to have that like eyeball stare thing, it actually wears me down a lot. It really does. So when my clients are tinkering with things and just organically talking, I notice my own energy is better sustained, especially through long days of, you know, we're all working full-time jobs, right? So it's like, whoo, let's just keep some of the focus buried. So you don't have to have a bunch of things to create opportunities for play. And you'll notice that creates like organic environments is the word that just keeps coming to mind. It's the teacher. I was taught that environment shape behavior. So as a preschool teacher, we never had the blocks by housekeeping, right? We had the cars and the blocks. We got lots of like, you know, kind of stuff. But housekeeping, dress up, the softer things, not on the other side of the room. I'm not going to have the blocks right by the books. Because if somebody's throwing a block, you know, a bunch of 3-year-olds, it doesn't need to hit the kiddo chilling out in the corner reading a book in the home. So environment shapes behavior, and there's a lot of environment your clients are in that is influencing their behavior, but they can't necessarily change it. So then we're looking to change the internal environment. And that's what these interventions can do. You can say, you know how you practice? Just messing with that, you know, felt marble ride. You know, that is something that you can imagine feeling that calm while you're sitting in the Social Security office waiting for your number to be called, or riding that bus, feeling anxious that there's a lot of people on the bus. Just remember, you know you can calm yourself. And so let's practice that internal landscape, internal environment. Okay, questions or comments about the window of tolerance? Okay. And yes, there's lots of artwork you can do around it. Yes, super cool. Vision boards and all kinds of things. So what we're going to do next is I'm going to invite you to go to the other side of the room. Just a moment. I want to share an acronym with you that is a breathing practice. As again, we've been doing a lot of bottoms up work today. Pressure, air, tension, heat. We can ask our clients what path they're on. We looked at the river, and we can always amplify those metaphors. We can say, what's your life raft like? What's in your life raft? And so forth. We can have clients draw their rivers. So this can also be a form of play. We're switching gears as we're working our way towards the last interventions of today.
So, this is just a tarot calendar that I like some of the images and I laminated it. So you too might have access to more tools, more ways of play. Then you realize once you start kind of looking through this different lens of what play can be. So I'd like you to, as you are, you can take it from wherever you want it to go. But thinking, what does your path look like right now? Whether it's personally, academically, at your site, what does your path look like? And I'll give you a moment to then do a body scan to see where you feel any pressure, air, tension, or heat. So as you're ready, I invite you to stand up, go to the far table, and choose a path card. And I'll come along and collect the ribbon cards. And imagine you're on that path and do a body scan, starting at the top of your head or your toes up, scanning for pressure, air, tension, heat. I feel like the word. So once you've done your body scan, let's reflect back on those values from earlier in the day. If you feel pressure anywhere, tension, heat, reflect upon those values you've been living out and ease up on yourselves. Do you feel any airflow within you? Validate that. Appreciate and respect the effort you and your body are putting into carrying that alignment into a safe and protected space as you offer therapeutic connection. Okay, for the sake of time, I need to continue moving us along. So just checking in, if I could get 2 or 3 people to just share their response to this experience. Where are you on your path and what is it like for you? This is my path. It's pretty sunny. I feel like things are going well, but I'm still like in the thick of it right now. But there is a way out. I just gotta stay on the path and do what I'm doing. Feel a little tension, but I gotta, if I stay on the path, I'll get through it. So. I chose this one because I'm finally at that point where I can kind of see the tail end of things. I'm not there yet though, so I'm still like in some of the trees, but I can see the sunlight glistening, so I'm almost there. But it takes some time.
I think this one, it kind of reminded everything around me is like a so there's like a lot of moving parts, there's a lot of unknown around me, but the path is very clear. Like I'm very set on what I want, like the expectations for myself and what I hope to achieve in my goals someday, not like if they don't happen, but like when they don't happen kind of things. But I kind of like think like everything else is kind of up in the air. Well, it's not but the path is.
So in this activity, you guys could see yourselves doing with your clients. So if you're working with adults that have phones, there's times I lean into that and I say, let's choose an image of a path on your phone. And sometimes they might have pictures, vacations and such. And so saying, I know I'm on my path, I see the lights, I'm still in the thick of it, it's blurry. Yet you guys are giving yourselves, again, these naturally designed affirmations that are meaningful to you, is offering that to your client. There's been several times where that or a river picture, something like that, that is inspirational and motivating to them. I encourage them to change their phone's home screen or lock screen to that image. Same with some of the cards. Sometimes they'll take a picture of a card or a therapeutic art piece. It's theirs. It's their PHI, really. And use that as a phone screen because it's this like slow titration of hope and optimism. That optimism you guys were talking about. This is my effort. When I was visiting with my counselor, I did this activity. It had meaning, and I'm going to keep moving forward by reminding myself. See, I'm on my path. Oh my God. What's about the path, right? So again, there's ways that it can be back to that Vygotsky picture of the tools and technologies that can be available to say, okay, we're not always with them, yet they can be their own mentor by conceptualizing therapeutic things outside of therapy. We just need the reminders. Okay, so what I invite you to do next is we're going to do another art activity. So have you guys heard of rainbow breathing? Yes, no, maybe? Okay, yeah. Okay, so what I'm going to invite you guys to do is all of us stand up. Yes, let's do it. People who are visiting us virtually, I encourage you to stand up if you can, wherever you are, if you feel safe to do so, and join us in this activity. Our bodies have been working hard to focus. So it's pretty fun.
I do this with adults. I even put on the kid mindfulness YouTube videos, like 5 minutes. And it's so validating when on goal sheet after goal sheet, they report what skills they're using, rainbow breathing. So as a former preschool teacher, I say I work with adults and our 3-year-olds. Okay, so as you guys are ready, I encourage you to let your body kind of shake it off, get into a stance where you feel like your hips, your shoulders, your head, you are in alignment with you. And then it's up to you if you want to soften your gaze or close your eyes. But as you relax and put your hands by your side, we'll breathe in and lift our arms up and imagine that we're painting the red. We'll breathe in, the red, and then breathe out. Now we're going to paint the orange in and out. Next is yellow, in and out. Green, in and out. Blue, in and in. Five, in and you just let it be itself for a moment. So again, these are long days and you guys aren't out of the woods yet. You're getting closer on that path. Okay, so as we're all standing up, stay with me another moment. Another is infinity breathing, and we can trace a figure 8 or the infinity sign, breathing in and out. And star breathing, where we're tracing the points of the star. These can be great things for people to doodle. So some of your folks who are lower on Maslow's hierarchy of needs, and they don't have much, if we're able to remind them, they can do infinity breathing or star breathing on their hands. I've had college students work with me, and they'll tell me they do it on their legs under the table when they experience anxiety in class. So these are tools where we say, you are taking your body with you. Let's take care of it, and it takes care of you. So next, these have been our bottom-up practices. We're going to switch gears to a top-down practice. So there is an art prompt here. I invite you, as you're ready, migrate to that table. There's white paper, markers, and crayons. Get the paper you'd like and the colors you'd like, and depict the rose check-in. So thinking about today, just today's training, any parts of it, what is something you're grateful for, or something that is a positive that you're going to take with you? You can give yourselves credit for your efforts today. A thorn, is there something stressful or challenging to you? Or something that you could use more support with? And finally, the bug. What's something that you look forward to besides this training today? What's something that you look forward to that gives you hope, motivation, or inspiration? Folks online, hopefully you're able to see that slide, and we encourage you to join us in doing that doodle. 20, so I'll give you guys about 5 minutes. Please do not overthink. One of the things about art and play prompts is you'll notice I'm very clear about time. I communicate time because art and play often gets people anxious anyways. So if they know there's a time boundary, they feel a sense of power and control. I absolutely want them to feel. also why I give the countdowns just like I would in play therapy. I'll come around and collect your pack. Was this easier or harder to do than this morning's music art prompt? Harder, here we go. And this is why it's so important that we do the interventions ourselves before we offer it to a client. Because somebody might say, oh, this will be easy, let me do it in session. I saw it on Pinterest, right? Like, it happens, right? And then this is harder. Oh no. So one of the things about Sandtray is the really high cry rate, guys. Like 95% of the time, somebody is going to cry over Sandtray. And it's important for, again, that's why I'm so fierce about getting more training for that modality, because they can catch themselves off guard and get out of that window of tolerance quicker than they or you might be ready for. Art can elicit similar responses. So I appreciate that feedback that, again, different perspectives are going to determine what's like easy, hard. We can stick with those words. Okay, so as you guys are working through this art prompt, if I could have 2 people share what they created.
I thought we were supposed to make a rose. So I made a rose. And then there's little yellow flowers because they're pretty. And yellow is my favorite color in this center. Yes, yes. That's it.
Okay, and so excellent example. There's times where we're gonna take it where we need it to go. And it sounds like you were like, we got a rose and enjoy being present. Yeah, really important. Okay.
And my main rose is like, I received it not only just like for today, but this week. I found a lot of encouragement and support from like a lot of different systems. Which I like the bud, I've been like practicing and trying myself a page of like just practicing stuff on my own and with other people. And then thorn was like personal expectations, and that's today and just in general this month. It's like giving myself forgiveness to make mistakes and understand like no one's perfect, we're all human.
So we did this practice in our PHP setting. We did a 6-week curriculum that was like a standalone kind of curriculum that we designed. And the end of each day, we gave them a big sheet of paper and we said, every day you're going to do this, if you choose to, of course. And they ended up with like these really fun, very different dynamic rose gardens. You can imagine after 6 weeks of attending 4 to 5 therapy sessions a week, that's a lot of flowers. And they enjoyed it as a reflective practice too, that the things that were thorns at the beginning of those 6 weeks became buds or roses. Some of the buds, something that they were looking forward to, became a rose because it had happened. And so this is a fun way. And of course, there's lots of other ways you can bring this version of play in to act as a reflective tool. So any questions or comments about this exercise? Are we noticing how it is a top down compared to bottom up? Got you thinking, and maybe even thinking you don't want to think, because a lot of our brains are tired. So again, my belief is that we need 2 tools in our tool bag. We need a top down practice and a bottom up practice. That can look really different days, different ways. And yet when I've conceptualized it from that more simplistic form for my clients, it's made skills more tangible. Sometimes you might see there's a worksheet that floats around the internet and around offices of 99 coping skills. And it's like, and they're like, too much. And we know the brain has its default mode network. And we're looking to help them shift what their default settings are. So maybe instead of expecting that everybody's going to reject them or everybody hates them, we're working with them to switch that and say, you can be safe on the bus. You can get your social security card. For some of you working with littles, you can tell your teacher you need to go to the bathroom, or you can tell your school counselor you experience test anxiety. We're trying to help them come up with ways to communicate and express themselves, even though it's going to take them out of their window of tolerance, and to say, that's okay. We're just going to get back to that optimal zone by either calming down or lifting up. And that's what I've tried to offer you guys today. For a little rewind, for the path piece, there's times I give my clients like a gingerbread kind of cutout and have them draw pressure, air, tension, and heat.
we were talking about the weather check-ins for moods. Yeah, those are great too, is we're able to say, you know, depict your mood as what the weather forecast is. So there are these ways that even with adults, even with some of my, yeah, because again, I've worked with dementia clients too. These can be really useful. You're just working on different parts of the brain. Okay, so as we're getting towards the end, I want to validate all your efforts and also bring to light another child development theory. Parton's 6 stages of play. So it was great when you guys were doing the magnets, cars, marble, and it seemed like each table group said we started off on our own, right? You guys just start picking up pieces and then start tinkering with the pieces more intentionally. You start recognizing there's other people here. What are they doing? Oh, hey. Maybe we can tinker with it together. And in the end, there was a lot of collaborative, community-based laughter and connection. So again, you've organically lived this out just today by doing something novel. So there are some clients that you're going to meet who these stages of play have been interrupted, whether it was, again, trauma, abuse, or neglect, or maybe it's something within themselves if they have, you know, difficulty with cognitive load and so forth. So to say, okay, when you're offering play to your clients, you're going to be able to naturally see kind of where they fall. And if there's a way that you're able to bring them into connection gently, not all of them will. So that's why I wanted to be able to remind you guys, she was saying over there, expectations were some of her thorns, and that's part of it, is keep your expectations lower on yourself. If your client doesn't want to engage in that, it's perfectly fine. You can pivot. Again, I put toys, right, fidget toys on the table, and it's been up to you guys to autonomously decide what to do or not to do. So we don't take any of that personal because we're setting lower expectations. We do want to set the scene. Again, I tried to create different environments you guys could navigate without overwhelming you. As a Sandtray therapist, a lot of my items are in baskets. In the Sandtray world, you'll see that a lot of people do beautiful shelving and all the items are open and accessible. However, for my situation, my clients have so much trauma. I'm looking to create an environment that supports containment. You are held, you are safe. And so by containing the items, I'm empowering them to also contain themselves rather than being overwhelmed with so much data coming at them. Again, this is also a group environment. So they have all the data of all the people as well. So we're setting the stage in simple ways, lowering our expectations, and then we're just present and engaged. Again, for me, there's times where I might even bring about a play or an art activity because I'm low energy. Person of the therapist, maybe I have a lot going on in my life, and I know if I bring out Rush Hour, I feel confident with that game, and so I'm able to more low energy, yet high support, be in the space. I'm not going to introduce a game or an activity that I'm less confident in when I'm in that space. Now, when I'm like, ooh, I went to a conference, I found the thing, I got the training, let's do this. Then I also will, again, be transparent with my clients and say, hey, this is new to me. I'm open to feedback. Because we do want to be upholding trauma-informed care principles just naturally. Okay, so we're going back. So play personality. Has anybody heard of the National Institute of Play? Okay, again, once you guys are launched, like you're gonna see the world is so big and marvelous.
So there are so many different fields out there that have therapeutic properties. Dr. Stewart Brown is one of the founders of the National Institute for Play. It is not play therapy. It is actually not counseling at all. Yet it's super, super cool, and my clients absolutely love it. So you can go on their website and you can see videos and a whole storyline about a polar bear and a sled dog, if you get curious. The short story, though, is that biologists partnered with him and other play researchers, and through observation of different animals, and there's peer-reviewed articles, they have their own journal, it's pretty cool stuff, is that play is a part of our foundational existence. If we have what is called deficient play histories, we have a higher likelihood of having social emotional glitches. So that entity in part came to being because Dr. Stewart Brown, trigger alert, like we're all here in Texas, so you might know, going back to like this slide for a moment, trying to be cognizant of our time, is the Texas Tower shooting of, I believe, 1966, Charles Whitman. And there were a lot of variables that went into what occurred there. One of the findings that emerged is he had, again, what is called a deprived play history. Alcoholic, abusive father. He didn't get to go through his developmental stages in a way that was useful to him. So when there are deprived play histories, we can end up seeing lack of empathy, lack of social emotional connection. And if you go on their website and do some more reading, you're going to find that they say every school shooter, all the way to Uvalde, has some aspect of what is called a deprived play history. So this is why when you guys are working with adults, kids, absolutely, they can just enjoy play. It's still in their wiring, where adults might have negative connotations and judgment about play. And yet it is indwelling. It is a part of us that makes us healthy and happy. So in the work with biologists, there was that moment they captured on film about the sled dog and the polar bear, and the sled dog gave play cues. And the polar bear responded accordingly, and you end up seeing pictures of like the sled dog pretending to bite the polar bear's neck, and the polar bear exposing his belly, you know, all soft mammal, vulnerable to the sled dog. And it really is beautiful to see that play is part of all of us. Okay, so they're not evidence-based yet. Again, this is still a newer field, but you can go online and take little quizzes to see what your play personality is. I found that in therapeutic work, this has been helpful to validate my clients' natural strengths, especially when it's Friday and it's the weekend and we're saying, what are you going to do to engage in play? And there's times when they don't think cooking their favorite meal, again, they get kind of hard on themselves. They're like, I really think it's play, is it? Like, are you having a good time? It's play. Like, you get to make this up. You get to define what play is to you. Ultimately, Dr. Stewart Brown says it's purposeless activities. And that's what we're looking for, is some purposeless activities. Okay, so one of our last activities, I checked my time, 1:40, we're on track, is I'll give you guys about 8 minutes or so to do something ambiguous. I find that, and some of you guys have already encountered this, but when I offer play that has no set rules, there is often an increase in anxiety. So on the back tables there, I've got 3 different options. So as you're ready, I invite you to stand up, migrate to that side of the room, and engage in purposeless activities. I will be your timekeeper for 8 minutes.
You go get it.
You've got to be kidding me.
If I can bring the laptop over my way. So what was it like to engage in ambiguous play? Nobody told you the rules. You just get to make it up. What was that like for you guys?
Yeah, I had a pretty cool moment. I was just randomly putting, or I wouldn't say randomly, just going for a symmetrical setup with these little geometry blocks and ended up making like a circle out of nothing but straight lines, which I guess technically it's a dodecagon, but I mean, it looks like a circle and that's pretty cool. So that was pretty sick.
Nice, nice. So making something out of nothing by putting those steps one after the other. Thinking about your client that's stuck. I can't make a circle. Oh, but actually I can out of straight lines. Yeah, pretty cool. Other experiences with nobody telling you what to do, what is right, what is wrong.
That was relaxing.
I can't remember this.
It's like we would talk through the dates here and there, and that was nice, but also just like doing whatever was.
So I bring this up because again, some of this is going to be cultural, some of this is gonna be generational. You can tell it's white hair. I come from the generation where the Legos did not have instructions. Legos were still pretty new. They were like the advanced leaping blocks, basically. However, I now have clients that when I put adult clients, when I put these things out, I've seen full-blown panic attacks because they say, where's the instructions? People are so afraid of failure, of imperfection, of judgments, whether it's social, external judgments and comparing themselves to others, or internal judgment. I'm not doing it right. And that we know that can lead to shame. That difference between guilt and shame, guilt being I did bad, and in the research, guilt is corrective, versus shame, I am bad, and shame leads to despair. Guilt gives hope. I can learn from it and do different. I can make on cool, right? So also, but for other people, you're right. They're able to pick up the Legos, pick up the things, and it's mindless. And in the same sense, it's mindful, not mindful, but mindful. And you just start chatting. So again, how much pressure is off you and the client if you offer a therapeutic experience for them to tinker with? And as you said, you guys started just chatting organically. And so those are some of the glimmers I just have up there, more from like ACT kind of language, lectures and glimmers. What are those glimmers where you see hope and you see sparks of insight, awareness, body posturing, but also glitches. Maybe something didn't go quite right.
if I've thrown a bunch of new clothes in here with these Legos or off-brand Legos that don't really, see, you already got the glitch going right there. Yeah, maybe then I am trying to, with intention and permission, say, hey, are you okay if I frustrate you a little bit? There's some new clothes in there. Yeah. So these are just, again, those natural moments where they say, yeah, life is ambiguous. We don't have the instruction book on all this stuff. It's hard. In the case from this morning, the mom, under-parenting, over-parenting, whatever she was doing as dad's trying to work. And so there's a lot of ambiguity there for that little girl, Lena. In the case example, she's got lupus. There's a lot of ambiguity on that. So again, we're providing safe ways for them to work through some of these things without straight up calling it saying, okay, so lupus is really tough. Let's practice distress tolerance skills by playing with blocks. That's one way to shut an 8-year-old down. Compared to, again, just providing an environment of play and seeing what they choose to do. Back to those 5 human needs. What do they choose to do with freedom? How does belonging and connection and power show up? Okay, so as we're in our last 10 minutes or so, the final intervention I have for you is Hot Wheels based. And you are welcome to take this paper and keep it with you. You now have had hours of me sharing, almost indoctrinating you in my belief about top-down, bottom-up practices being helpful to both you and your clients. So my metaphor for cars is every car has 2 brake systems. And this is what we're looking to do is help our client figure out how to stop. Whatever it is that they're doing, being down on themselves, being stuck on certain things, overthinking, underthinking, whatever the thing is, we're trying to help them flip that script. So metaphorically, we know there's a brake, and if that brake doesn't work, there's a backup brake. There's an e-brake, an emergency brake. So I talk to my clients and say, those are your 2 internal skills. Breathing, journaling, dancing to music, talking to a friend. Now, these don't have to be one top down, one bottom up. I'm certainly not going to be that rigid with my client. Like, that's not nice. So I invite you guys to also be open to that. But thinking about 2 go-to coping skills that work for you. Because I find that a lot of times for my students and my associates, is your natural coping skills will align with the theory. And sometimes we work backwards. We say, what is helping me get through the stress of grad school? There's probably a theory that matches with that. There's a reason why I like mindful self-compassion so much, because I had a very loud inner critic before I could befriend her and get through some of those processes myself. So 2 coping skills that get you to stop, that are internal, because we're taking us with us, right? Internal. And then, do you guys know what a runaway truck ramp is? Like, I know South Texas is pretty flat. I come from the land of mountains. I'm from Northern Nevada. So I definitely love a good mountain drive, like Yosemite, Tahoe's my place. So what's a runaway truck ramp? Go for it.
You're going downhill and the brakes go out, so it's like a side area off to the highway that the truck takes to go straight up.
Beautiful. And there's times where you are that for your clients. My Pathways people, Pathways is like that runaway truck ramp in a way, right? Is things went sideways, your brakes weren't working, but you know what? You're gonna come here and you're gonna be able to stop and land into the group. Sometimes that runaway truck ramp might be them calling 988. Or it might be calling, the next safe person. Or it might be taking their meds. It's something that is outside themselves. So when I boil it down for my clients and I say 2 internal coping skills and 1 external coping skill, it seems to simplify things for them and me. Because then I'm able to validate that and say, hey, we're just working on this funneled down data rather than this plethora of everything coming. But also, as you guys as students are exploring theories, exploring different diagnostic presentations,
you're also able to allow yourselves to say, hey, these are just the few things that we're focusing on for right now. So I invite you to come pick up a page, choose your Hot Wheel of choice, and then debrief with your table groups what car you chose and what skills you use to slow yourselves down and keep yourselves on your. So we'll do that for just about the next 5 to 7 minutes, and then we'll wrap today up.
I feel like but I have to like. Well, I know we're it's a PowerPoint.
And then write down. Like one on your I have to be like, yeah.
Like, what do you decide?
This takes a good break.
Taking a break to like, yeah.
At the end of the day, when I figure out my words.
First music on, going to the gym, trying to go outside.
My break is emergency break. My emergency break is going to the beach by myself.
I always want to do that, but I've never gone.
You've never gone.
No, not myself.
By yourself, so.
Yeah.
It's best it is. Yeah, yeah, oh, yeah, I do that. I've done that. Especially since we started.
Okay, let's get to these polls. Yes, can you see the screen? I love the videos, like again, and you know, but I amplify that, I love it. Because again, it reminds us that we are humans that are not meant to be still. Whether it's for people working 9 to 5 in an office, or your littles that are supposed to be sitting still in school, staring at a blackboard, we are dynamic creatures. And so allowing your clients that space to fiddle and tinker is a form of play that opens up these different gateways to that natural cohesion between brain, heart, and gut information. So as we wrap today up, I'm hoping that you've had some tools that you can take with you. And any ideas, my contact information is up here. You're welcome to reach out to me. If there's any questions or comments, I'm happy to stay after for a few minutes. I want to make sure I turn it back over to Dr. I and Kelsey. I just appreciate you guys.
Let's give another round of applause. We did such a great job. Thank you so much. That was excellent. And I loved how interactive it was, and it was just full of information. And so we're gonna love to invite you back another time too to give us some more of your knowledge and insight. So thank you so much. And that's all we really have today. So feel free again to let us know if you have any any other things. If you have any of the ACT books, please let us know. I guess we're turning them all in now, but if any of you still have them, please turn those in. Otherwise, y'all are free to go and enjoy the rest of your weekend.
And don't forget the 26th,
Yeah.
virtual, so this is our last training in person, okay?
We signed up last semester, even though we started. Me and Brianna, we put it on.
Okay.
We're told like, oh, you're gonna die, you're gonna go there. Yeah. We're just happy hour. We didn't go out, we didn't have the last. I'll say we're starting. One at like knowledge.
Oh, with that.
Because it was total 5. Yeah.
Did we have Jonathan respond again last time? He's like.
Oh, okay.
Yes. Yeah.
And I know you like this.
No, it's yeah, we're really looking at as far as like you're talking about the presentation.
Okay.
Oh, okay.
That'd be good.
So as far as the presentation, I'll make it, right? That and really, we just need to, come to like the data. Support to the average score for it, maybe for your program and the next program. And how we did something.
Oh, I haven't seen that. I have supervision with you.
Oh, okay. You can do those calculations with your big data.